Health Services team ng Kagawaran ng Kalusugan. At I welcome all our local chief executives, officers of the Regional Centers for Health Development at ang mga miyembro at opisyal ng mga senior citizens group ng Mindanao. Kasama po natin ngayong umaga ang mga eksperto ng Kagawaran upang magbigay linaw sa mga katanungan at agam-agam ng ating mga lolo-tola hinggil sa COVID-19 at sa pagbabakuna. Kasama po natin ngayong umaga ang DOH spokesperson USEC Dr. Maria Rosario Singh Vergeire, ang ating NITAG expert Dr. Nina Castillo Carandang, ang ating expert at guest from the Faculty of Medicine and Surgery ng UST, Dr. Mark Henry Hoven, from the National Vaccination Operations Center, Dr. Keja Rosario, at from the National Commission on Senior Citizens Chairperson, Attorney Franklin Quijano. Makakasama rin po natin mamaya ang ating representatives from DILG, USEC Marlo Iringan, USEC Martin Dino, at mula sa Liga ng mga Barangay sa Pilipinas, Mr. Hans Trabado at Ms. Princess Medina. Mula din po sa Health Promotions Bureau, Dr. Alfonso Miguel Regala at Director Alithea de Guzman of the Epidemiology Bureau. Ngayon po, upang magbigay ng kanyang paunang bati ay ang OIC Undersecretary for Health ng Public Health Services Team ng Kagawaran ng Kalusugan at ang official spokesperson po natin, Dr. Maria Rosario Singh Vergeire. USEC, the floor is yours po.
Maraming salamat, Casey, at magandang umaga po sa ating lahat. Nais ko pong pasalamatan ang ating mga kasama sa okasyong ito, lalong-lalo na po yung mga kasangga at kaisa natin sa paghahatid ng proteksyon sa ating mga senior citizens. Lagpas 4 na buwan na po ang nakalipas mula nung dumating sa bansa ang mga pinakihihintay po nating bakuna laban sa COVID-19. Ang pagdating po ng mga bakunang ito ay nagbigay sa ating lahat ng bagong pag-asa sa ating ligtas at sama-samang pagbangon. Ngunit dahil po ang COVID-19 ay isang pandaigdigang hamon, hindi po natin maiiwasan ang iba't ibang pagsubok gaya ng supply ng ating mga bakuna. Nariyan na po na nakikita natin ang kakulangan at kumpiyansa ng publiko sa kaligtasan at pagiging epektibo ng mga bakuna na meron tayo sa bansa. Lalong-lalo na noong tayo'y nagsisimula pa lamang sa ating programa sa pagbabakuna. Bilang tugon sa limitadong supply ng bakuna, ay naipatupad po natin ang vaccine prioritization na binuo natin kasama ng ating mga kasangga from the WHO at ang ating mga eksperto. Upang tuluyang mahikayat ang publiko sa pagbabakuna, nariyan na po ang aming kampanya upang labanan ang anumang maling impormasyon na nagdudulot po ng agam-agam sa ating mga kababayan at lubos na mapataas ang ating vaccine confidence, lalong-lalo na po sa ating mga high-risk population groups. Ito rin po ang ating layunin dito sa ating Tutok A2 Information Caravan bilang pagkilala sa ating mga lolo at lola na kabilang sa ating mga high-risk population at upang hikayatin silang piliin ang dagdag na proteksyon na hatid po ng ating mga bakuna. Naiintindihan po natin ang iba't ibang pananaw ng iba't ibang sektor ng ating lipunan. Maaaring kaisa rin po natin ang ating mga senior citizens sa adhikaing ligtas at malampasan ng pandemya. Ngunit maaaring iba din po ang katanungan at agam-agam na umiikot sa kanilang mga isipan. Atin pong inorganisa ang information caravan na ito kasamang ating mga eksperto at kasangga upang pag-usapan ang mga mensahe ng kaligtasan at proteksyon dala ng ating mga bakuna. At makatulong po ito sa pagpapataas ng vaccine coverage among our senior citizens in the country. Critical din po sa usaping ito, lalo na't may binabantayan tayo ngayong Delta variant. Marami ng bansa sa buong mundo ang nakakaranas ng pagtaas ng kaso dahil sa Delta variant na ito. Kaya't kailangan po nating pag-igtingin at pabilisin palalo ang ating paghahatid ng proteksyon dito sa ating mga mamamayan sa ating bansa. Makakasama po natin ngayong araw, katulad ng sinabi ni Dr. Casey kanina, si Dr. Nina Castillo Carandang. Siya po ay kasama natin at eksperto ng Department of Health mula sa National Immunization Technical Advisory Group. Kasama rin din po natin si Dr. Mark Henry Hoven Mula po siya sa University of Santo Tomas, Faculty of Medicine and Surgery. We also are privileged to have Secretary Pangarungan mula sa National Commission on Muslim Filipinos. We have Dr. KZ Rosario from the National Vaccinations Operations Center. And of course, we have Attorney Franklin Quijano, the chairperson of the National Commission on Senior Citizens. Makakasama din po natin as resource persons, Undersecretary for Local Government Mario Iringan at Undersecretary for Barangay Affairs Yusek Martin Dino, mula po sila sa Department of Interior and Local Government. Makakasama din po natin Deputy Executive Director Hans Trabado at Political Liaison for Luzon Princess Medina mula po sa Liga ng mga Barangay at ng Pilipinas. We will also have Dr. Alfonso Miguel Regala mula sa Health Promotion Bureau ng Department of Health. And lastly, we will have Director Alethea de Guzman from the Epidemiology Bureau of the DOH. Naway maging makabuluhan po ang ating diskusyon sa ating info caravan nang sa gayon ay mabigyang linaw po namin ang mga katanungan ng ating mga lolo at lola tungkol sa pagbabakuna. Muli po, maraming salamat sa inyong pakikilahok at kinagagalak po namin na kayong lahat ay makasama sa araw na ito. Maraming salamat po and good morning to all of you. Over to you, Casey.
Thank you po, Yusek. Ang una pong magsasalita at magbabahagi sa atin ngayong umaga ay ang eksperto po natin from the National Immunizations Technical Advisory Group upang paliwanag sa atin ang sitwasyon ng ating mga senior citizens ngayon. Si Dr. Ranina T. Castillo Carandang. Dr. Ranina?
Mayong buntag. Thank you, Dr. Casey. Do you see my slides?
Yes po, Doc.
Okay. Mayong buntag sa ating tanan. Nakita ko kaagad na mayroong mga nakataas sa mga kamay. Baka gusto ho muna nating ibaba. At malayo-layo pa ho tayo sa tanungan. Thank you po. So babaho natin ang mga kamay para hindi po siya nakakasagabal sa ating kwentuhan. So what I will share today ay tungkol po sa sitwasyon po ng COVID-19 sa mga senior citizens po natin at ang pangangailangan po natin para sa pagbabakuna at sa good information hygiene. So mamaya po ipaliliwanag ko kung ano po yung good information hygiene. So sa kasalukuyan po ay meron tayong 1.55 million cases nationwide ng COVID-19 as of July 26, 2021. 14% po ng mga kasong ito ay sa senior citizens. So makikita nyo po dito sa pinapakita ko sa inyo na marami naman pong asymptomatic. So, ibig sabihin pong wala pong nararamdaman na sintomas. Marami din po na bahagya lang po ang nararamdaman. So, mild lang po, no? Meron din namang katamtaman ng nararamdaman na sintomas, pero meron din po tayong malala o severe at saka critical ang nararamdaman na COVID-19. Sa magandang balita naman po is marami din po ang nakaka-recover. So, 87% po, halos siyam kada 10 na senior na nagkakasakit po ng COVID ay gumagaling naman po. Kaya lang po, ang malungkot na balita din namin, gusto naming ibahagi din sa inyo para lubos niyong maintindihan. Ang pangangailangan para sa pagbabakuna ay meron na po tayong 17,493 na mga seniors din pong namatay sa kasawiang palad, no? So 8.16% po na mga namatay, meron na po tayong 8.16% na namatay po, no? So susunod naman po, pinapakita po dito na doon po sa 17,493 deaths among seniors, higit po na mas marami pong namamatay na seniors kesa po sa iba pong age groups. So anong ibig pong sabihin nito? habang tayo tumatanda at meron tayo iba pa mga sakit tulad ng hypertension, diabetes, cancer, is mas malala po ang ating risk para tayo ay magkaroon ng severe COVID or unfortunately po, mamatay din dahil sa COVID. So sa kabuuan po, more than 27,200 Filipinos have died due to COVID nationwide. And 8.16%, 17,000 po and plus are deaths among seniors. Pero kung isasama po ninyo yung deaths among seniors na may comorbidities, 53% po iyon. No? So madami po ang namamatay. At ang case fatality rate, ang ibig sabihin po nun, yung bilang po na namamatay sa mga nagkakasakit, sa lahat mo ng age group is 1.75. Pero pag senior po kayo, ay tumataas po yon. So there's an 8 times more risk na kayo po ay maari po magkaroon ng severe COVID at maari pong mamatay kung kayo po ay senior citizen. So ito po ang data natin sa iba't ibang region ng total number of cases, total deaths, at saka yung bilang po ng mga namamatay sa bilang po na nagkakasakit ng COVID. So sa lahat po ng region yan, at nakikita nyo po dito, so nakita po kanina marami po sa inyo sa nasa Mindanao po ngayon. So ito po yung data po ninyo from Mindanao. The total cases, the total deaths, and the case fatality rate. Tulad po ng sabi ni Yusek Rosette kanina, ang sitwasyon po natin ay lalo pong pinabigat kasi marami po tayong variants na umiikot-ikot. Ang problema po sa variants ay hindi po natin kaagad na-detect ito kasi kailangan po ng masusing pag-aaral bago po ma-identify yung variants. So ito pong variants na ito, naririnig nyo siguro, Delta variant, Alpha variant, kung ano man po yun, ay highly transmissible. Ibig sabihin po nun, mabilis po siyang kumalat. Ano naman ang problema po nun pag mabilis pong kumalat? Maaari pong sobrang dumami po ang ating mga pasyente at maaari pong mahirapan po ang ating mga ospital, doktor, nurse, midwife, be heard sa pag-aalaga po sa lahat ng mga may sakit. So yun po ang delikado dito sa variants na ito. So ito naman po slide na to, gusto ko nating ipaalala po kung ano po yung ating layunin sa National COVID Vaccine Deployment Program. Gusto po natin ng ligtas or safe, equitable, pantay-pantay po tayo, at cost-effective o sulit po ng pagbabakuna para po sa lahat ng Pilipino. At ang ating pong ambisyon by 2023 po ay makakamit po natin ito. Ano ang pangunahing layunin po natin para mabawasan po ang bilang ng mga nagkakasakit, morbidity po, at namamatay mortality? At kailangan po ma-maintain na natin, mapagpatuloy po natin ang lahat ng critical na serbisyo sa kalusugan, sa kalakalan, sa edukasyon, sa pamamahala, at lahat po ng sektor na mahalaga sa pagkilos ng buhay natin bilang Pilipino. Ano naman po ang isa pang layunin para mapigilan po ang mabilis na pagkalat ng COVID-19 at mabawasan din po ang pagsagabal sa ating buhay-buhay sa pang-araw-araw, ekonomiya po, pati na po sa pangangalaga ng ating security internally po at sa labas. Pero ito naman po yung pinakagusto po natin, no? Tertiary goal, resumption to the near normal. Ako po ay social scientist. Hindi po ako sang-ayon doon sa term na new normal. Bakit po? Sa aking pananaw ay kailangan po tayo mas mataas ang ating antas na gusto nating abutin, a better everyday. Bakit po yun ang aking palagay? Kung hindi po tayo natuto sa mga mapait na karanasan natin ngayong pandemya, ay normal lang po ang ating aabutin. Pero kung tayo po ay natuto, baka umabot po tayo doon sa better everyday. Kailangan pong may pinagtutunan at may papupuntahan lahat ng ating paghihirap at pagtitiis po ngayon sa gitna ng pandemya. Ito naman po, pinapakita natin na dahil kulang po ang ating supply ng bakuna at iba't iba po ang risk ng exposure, meaning po ano yung panganib kung ako kunyari ay health worker? Ano ba ang panganib ko okay senior citizen? Ano ba ang panganib kung ako'y may comorbidity o ako ay frontline personnel, no? So, yun po ay tinitingnan yung panganib sa COVID-19 dahil lagi kayong may nakakasalamuha. Yung inyong vulnerability, pag tayo nagkakaedad na at may mga iba pang sakit, ang pagkakataon na magkaroon tayo ng COVID ay tumataas. Yung burden of disease po, yung dami po ng kaso sa iba't ibang lugar po ng Pilipinas. Yung kakayahan po ng LGU upang tumugon sa pangangailangan ng mga sambayanan sa kanyang sinasakupan. At kailangan din po itong ibalanse sa limited vaccine supplies. Hindi lang po sa Pilipinas kulang ang bakuna, sa buo pong mundo. Ito ay primary problem. Kaya po tayo meron iba't ibang category. So ngayon pong umaga, ang tutok po natin ay A2. Pero hindi din po natin nakakalimutan yung A3, persons with comorbidities. Kasi katulad po na pinakita ko kanina, marami po sa atin lolo't lolo, tito, tita, atit, kuya, meron ng edad at meron din iba pang bitbit na sakit. So yun po yung kauna-unahan nating pinagbabasihan ng pagbibigay ng bakuna. Titignan din po natin ang dami ng kaso. Titignan din po natin ang supply at saka ang pag-transport po ng bakuna. Ang bakuna po ay maselan na asikasuhin dahil nangangailangan po siya ng cold chain. So ibig sabihin nun, hindi po siya pwedeng ilagay lang sa kung saan-saan at tamang temperatura po ay kailangan po para sa kanya. So lahat po yan, no? Kasi ang gusto po natin ay mabawasan ang bilang na nagkakasakit at namamatay dahil sa COVID-19 habang minimintina o patuloy po nating binibigay ang mga serbisyong kailangan ng mga mamamayang Pilipino. Dito po, pinapakita ko kung ano po yung coverage natin po ngayon. So, tingin po natin dito sa senior citizens. Ang estimate po natin is 441 million seniors ang dapat mabakunahan. Pero ito po, gusto ko pong tawagan ng pansin ng mga LGUs po, madalas po ay kulang sa inyong listahan ang lahat ng seniors. Nasa batas po yan na lahat ng LGU ay dapat ina-update ang listahan ng lahat ng seniors sa kung saan man kayong lugar sa Pilipinas. So ito po, tingin po namin ay underestimate. Kulang po ang bilang. Doon po sa napabilang po dito ay 2.8 million na po ang may first dose. 1.6 lang po ang merong second dose. So ano pong ibig sabihin nito? Sa first dose po na target na pang senior, 33% pa lang po ang nakakatanggap ng unang bakuna. At 18%, almost 19% lang po ang fully vaccinated na. Ang ating mga bakuna po ngayon ay karamihan po sa kanila nangangailangan ng 2 pagbabakuna. Iisa lang pong available na bakuna ngayon na once lang po ang pagbabakuna. So nakalagay po dito ay 19% pa lang doon sa mga nabakunahan na seniors ang fully protected with the second dose. So kailangan po nating dagdagan pa ho ang ating paghihikayat at pagbibigay ng serbisyo para po doon sa mga hindi pa nakakatanggap ng bakuna. Alam ko po na maraming naiinip dahil gusto nyo na po magpabakuna, wala naman pong supply. Antay-antay lang po tayo at dadating din po yan. Dito po, pinapakita yung data sa different regions po, no? Yung target nilang senior citizen population, ilan po yung first dose, at ilan po yung may overall coverage ng second dose. No? Kasi po, kadalasan po ng ating mga bakuna ngayon ay kailangan ng 2 doses po sila. So, eto po yan, yung sinabi ko po kanina, 33% pa lang po ang merong first dose at 19% pa lang po ang may second dose. So kailangan pa ho natin gawin pang ating homework. Basta meron na pong supply na available, pabakuna po tayo, lalong-lalo na po ang mga lolo't lola at yung people with comorbidities po. So ito pong slide na ito, pinapakita ko po yung survey ng Social Weather Station na ginawa ng June at saka ng Pulse Asia na ginawa din po ng June. So tingnan po natin, nung Mayo po, 32% lang po dito sa SWS ang gustong magpabakuna. Pero nito pong June, tumaas po yan ng 45%. Dito naman sa Pulse Asia, noong February po, 16% lang po ang gusto magpabakuna, pero tumaas po ito ng 43%. Meron pa rin pong hindi sigurado, so 24%. So gusto ko pong i-request sa ating mga LGU, itong mga taong hindi pa ho sigurado ang kailangan pa ho nating tutukan at kumbinsihin. Kasi malapit na po silang makumbinse. So dito po, sa SWS, 24%, sa Pulse Asia po, 16% ang hindi sigurado. Marami pa rin pong Pilipino, pero umunti na po from 33% in May to 21% sa SWS ang hindi payag ng magpabakuna. Dito naman po sa Pulse Asia, from 61% bumaba po ng 36%. So from 21 to 36% ang ayaw po magpabakuna. Kailangan pa rin abutan natin ng dagdag pang impormasyon at pagpapaliwanag po ang mga taong ito. No? Doon po sa mga sumali sa survey na ito, 10% na po sa SWS ang bakunado na. Sa Pulse Asia survey na ginawa din pong nationwide, 5% na po ang bakunado na. Ang DOH naman po, nung Mayo ay nagpagawa din po ng kanilang survey para maintindihan yung mga dahilan kung bakit magpapabakuna o hindi magpapabakuna. Dito po, sa highly likely magpabakuna, gusto po nila ng proteksyon sa infeksyon. Sila po ay willing, pero ang supply po ay hindi pa ho available. Antay lang po tayo at dadating din po yan sa ating LGU. I see COVID as enough of a risk to get vaccinated. So may nakikita silang personal nilang panganib na sila po ay magkasakit. Doon naman sa hindi magpapabakuna, 2% lang po ito, kulang po sila ng pagtitiwala sa pag-aaral tungkol po sa bakuna. Meron po silang concerns no sa side effects at sa tingin po nila ay hindi po tugma o angkop o sapat ang mga diskusyon tulad po dito sa mga side effects. No? At meron pong negative news about the vaccine. Doon naman po sa not sure, 10%, pareho din po nitong sa not likely, the concerns about possible side effects were not properly discussed and addressed. And again, may negative news about the vaccines. Pero tingnan niyo po ito, may medical reasons. I have comorbidities, allergies to the vaccines. Pero tandaan po nyo, at pag may comorbidity po kayo, ay mas mataas po ang tsansa na magkaroon kayo ng severe COVID or critical COVID or even death. No? Tapos ito po, my primary care provider advised me not to get vaccinated. Sino itong primary care provider? Pwede pong doktor, nurse, midwife po yan. Pero pwede din po yan yung mga kasama ni Lolo at ni Lola sa bahay. Yung mga anak po niya or apo niya o kung sino pa o ang kasama nag-aalaga po sa kanya. Dito po sa Pulse Asia survey nung June, pinapakita ko po, dun sa ayaw magpabakuna, bakit daw po? Not sure of safety. The vaccine might not be effective. A vaccine is not needed. Hindi daw kailangan ng bakuna para paglabanan ng COVID-19. Baka daw hindi libre o baka mahal. Libre po ang bakuna sa mga LGU po natin. Antay lang po tayo para dumating ang mga supply. Tapos ito po, meron po silang medical condition or maintenance medicines. Takot sa needles. Totoo po yan. No? Or already a senior citizen prefer not to be vaccinated. Ito naman po ang masasabi ko. Hindi ko mo kayo po ay may edad na, ay hindi na kayo pwede magpabakuna. Parang, ay, ang tanda ko na, ayoko na. Ang tawag po doon ay ageism. Ang feeling nyo, lolo, lola, tanda ka na, huwag ka nang mabakuna. Or ikaw mismo ang nakakaramdam nun. Tanda na ako, hindi na akong papabakuna. Hindi po dapat ganon. No? Ito na po yung pagkakataon natin na makatanggap ng dagdag na proteksyon. At isa pang dahilan po is the vaccine does not guarantee 100% protection from the virus. Wala naman pong 100%. Nasa iba pa rin pong pag-iingat po natin tulad gamit ng iba pang mga measures. Papakita ko po sa inyo ng paalala. No? So ang pinakamadalas pong rason kung bakit ayaw po magpabakuna o nag-aalinlangan ng mga senior citizens ay kulang po ng impormasyon. So lack or incomplete information. Sa National COVID-19 Vaccine Operation Center, yun naman pong schedule na po pero nagpapadefer, nagpapaliban ng kanilang schedule. Ang mga dahilan po ay nagkasakit po si Lolo, si Lola. They got exposed to someone positive for COVID, no? Or naka-quarantine po sila. Ang sagot naman namin po dito sa lahat po ng ating pinagdadaanan, tandaan po natin, consistent and proper use of face mask. So yung regular at tama pong paggamit ng face mask at face shield. Ang face mask po ay hindi kwintas, hindi ho necklace, hindi sa leeg po sinusuot yan o sa ilalim ng baba. Yung face shield po ay hindi po headband. Yan po ay nilalagay natin sa harap ng ating mukha at sa harap ng face mask. So consistent and proper use of face mask and face shield. Physical distancing. Ibig sabihin po noon, magkakalayo tayo ng physical pero socially connected tayo. Friends pa rin tayo pero baka virtual friends lang at malayo ang distansya natin sa isa't isa. Good ventilation, yung maganda pong daloy ng hangin. Kung kailangan po natin ng face-to-face, ay saglit lang po yan at saka sa open space with good ventilation. And of course, full vaccination. Kung gawin po natin lahat po ito, ang pagkakataon o panganib na tayo magkaroon ng COVID-19 ay bumababa. So tandaan po natin, lahat po ito ay kailangan nating gawin. We are physically distant but socially connected. Mga paalala po at pakiusap ko po. So kanina po pinakita ko sa aking title slide yung good information hygiene. Ano ba ho ang problema natin? Nasa gitna po tayo ng pandemya. So pandemic dahil sa COVID-19. Pero nasa gitna din po tayo ng infodemic. Ibig sabihin po ang malalang pagkalat ng maling balita, haka-haka, fake news, pati na po ang pagsisinungaling. No? So yun po ang spread of false information. So we need to practice good information hygiene. Kung tayo po ay naghuhugas ng ating katawan, nagpapalit ng damit para malinis po tayo sa araw-araw, ganun din po ang habits natin dun sa information nating isi-share. Yung mga messages po natin sa Facebook, yung ating sinishare sa Viber, sinishare po natin sa text message, lahat po yan ay pangalagaan po natin na malinis po yung informasyon. So be proactive about what you like and share online to have a positive impact on others. Hindi po siguro tayo aware na pag nagsishare po tayo, kung hindi po magandang balita or mali ang balitang kinuwento nyo, ay nakaka-apekto po sa iba. So we want to have a positive impact on other people. So tayo po as creator, may ginawa kayong TikTok video o nag-share kayo ng info sa isang FB post or YouTube video, kailangan pong siguraduhin nyo na maayos po yung inyong sinishare, na tama po yung informasyon. So hiniram ko po itong sabi ng isang scientist si Caulfield, sifting through the pandemic, information hygiene for the COVID-19 infodemic. So yung sifting po ay pagsasala. Para po tayo nagtatahip ng bigas, gusto natin tanggalin yung mga bato-bato bago ho tayo magsaing ng bigas. Ganun din po yung konsepto ng sifting. Nagsasala po tayo. So stop. Pag nakita nyo, wow, totoo pa kaya to? No, na mangha kayo o nagalit kayo o sobra kayo natuwa o gusto niyo nang i-share kaagad. Hinto muna kayo. Huminga muna kayo malalim. Teka, baka naman fake news, no? Letter I, imbestigahan, no? Alamin saan ba nanggagaling, sino ba nagpapakalat ng bali-balitang ito. Letter F, find better alternative coverage. Hanapin po nyo kung meron pang iba pang nagko-cover ng balitang ito na sinasabing balita nga, no? Tapos T is trace, no? I-trace nyo, sino bang una nagsabi niyan? Saan bang organisasyon yan? So balikan at sundan. So sift. Salain po natin ang impormasyon na ating sinishare at pag-isipan muna bago natin i-share sa iba. O bago din natin paniwalaan. So maaaring i-check sa DOH at sa iba pang evidence-based and reliable sources. Ang Department of Health po, ang World Health Organization, marami pong iba ding professional medical societies na may tamang impormasyon po. Doon po tayong tumangkilik, hindi po kung saan-saang Facebook page or YouTube channel ng kung sino-sino na hindi naman verified po yung sinishare. So ito po yung aking pulso frame. Love kita, halina at magpabakuna. Kailangan pulsuhan po natin ang mga kasama po natin sa ating tahanan, sa ating komunidad, sa ating opisina, kung saan mo tayo nandun, sa ating barangay. Alamin po ang mga agam-agam at katanungan po. Tugunan po natin ang mga katanungan na ito. Makipag-usap tayo at makipagdialogo. Iyakapin po natin, virtually lang po, bawal po yung physical, no? Para lang ho sabihin natin, naririnig kita at pinakikinggan ko ang inyong mga agam-agam at katanungan. Bakit po? Kailangan natin ng vaccine literate, yung nakakaintindi po ang mga Pilipino, and vaccine protected public. Yung mamamayang Pilipinong protektado ng dagdag dahil nagpabakuna po sila. Ang pagbabakuna po is an act of love. So ito po ay pagmamahal. Ito din po is an act of citizenship. Ako po ay Pilipino, ako ay mamamayan ng mundo. Ito po ay aking pakikisama din. So this is also an act of solidarity. So vaccination is an act of love, citizenship, and solidarity. Katungkulan po natin ito at karapatan din po natin. So please consider having yourselves vaccinated if eligible and when there is available vaccine supply. So love kita, halina at magpabakuna. Malapit na po ako matapos. Paalala po, ang bakuna pong ito ay hindi regalo ng mga politiko sa sambayan ng Pilipino. Binabayaran po natin yan sa ating buwis at pinangutang pa natin na ating mga great-grandchildren pa ho ang magbabayad. So, ito ay bakuna ng taong bayan. Hindi ito po bakuna ng isang politiko. Kailangan pahalagahan po natin ito, bantayan, gamitin ng tama para sa mas nangangailangan, lalo't kulang pa ang supply sa kasalukuyan. Isa din pong paalala, ang kalusugan po ay karapatang pangtao. Karapatan po natin yan, katulad po ng edukasyon din. Vaccine equity o pantay-pantay na access sa bakuna ay isa ding pagpapalawig ng ating karapatang pangtao. Access to the vaccine alone ay hindi po sapat. Kailangan din po may pagbabago sa buong sistema ng ating ekonomiya, pakikisalamuha po natin at mga polisiya para ang mga tao ay pantay-pantay at siguraduhin na natin na no one is left behind. Lahat po dapat ay protektado at may pagkakataong umasenso. Ang aking pong late nanay was a rural sociologist and a community development specialist. Noong 2003, nung reunion ng kanyang high school class sa Santa Cruz, Laguna, sumulat po siya ng isang essay and she entitled it, How to Grow Old Gracefully, Not Grudgingly. No? So ito po yung sabi ng nanay ko, have a purpose in life. It is not healthy to say we are in the departure area. Each morning when you wake up, there must be something to look forward to. There must be a reason for getting up. So hopefully po, when you get up tomorrow, your purpose will be to get vaccinated for COVID-19. Maraming salamat po sa Department of Health as a Communications Management Unit. Magandang araw po.
Maraming salamat po, Dr. Nina. At tama po, no? Ngayong panahon ng pandemya, hindi lang mga kamay natin ang kailangang hugasan at i-disinfect. Kailangan din natin ng good information hygiene, pati yung mga impormasyon na tatanggap natin at kinakalat. Kailangan nadi-disinfect din natin, or gaya na sinabi ni Dr. Nina, kailangan sinasala natin. So ngayon naman po, kasama na po natin ngayon dito sa call ang ating chairperson from the National Commission on Senior Citizens, si Attorney Franklin M. Quijano, pati po ang ating Undersecretary for Local Government ng DILG, Undersecretary Marlo Iringan. Magandang umaga po. Ngayon po tayo ay dadako sa susunod na discussion. Ito po ay patungkol sa vulnerability of senior citizens during the COVID-19 pandemic. At ito po ay ibabahagi sa atin ng isa pong eksperto at profesor natin mula sa Faculty of Medicine and Surgery ng University of Santo Tomas, Dr. Mark Henry Hoven. Doc Mark. Doc Mark, you're muted po ata.
Sorry, it's pre-recorded, so I think may technical.
It was projected that those above the age of 65 were to outnumber those under the age of 5. But obviously this did not happen because of the pandemic. In the Philippines, the top 5 regions with highest numbers of senior citizens, which is defined as age over 60, is Region 4A, Region 3, the NCR, Region 6, and Region 7. And this is the actual numbers of the population who among them are composed of senior citizens. So Calabarzon has the most number of senior citizens. And older adults, when they get COVID-19 infection, are at higher risk for morbidity and mortality. Shortness of breath may be more frequent among older adults. They might have subtle symptoms. Symptoms may not be present at all. A lot of them could be asymptomatic initially. And a large number of COVID-19 infections and death happened in nursing homes in other studies abroad. And delirium, or being confused, is prevalent and is associated with in-hospital mortality among patients infected with SARS-CoV-2 infection among older adults. In nursing home patients, so you're talking about nursing home patients who are high risk of dementia, Parkinson's disease, a lot of diseases, they're 3 times more likely to die within the next 30 days. They're likely to get admitted in the ICU, and most of them will present with typical symptoms like fever, cough, and shortness of breath, but atypical symptoms like confusion, nalito lang sila, they don't have symptoms, they can't, that's how COVID-19 presents with that to them. And delirium might be a prodromal phase of COVID-19 infection. Increased frequency of adverse events, increased hospitalizations, increased use of restraints because they're confused, and antipsychotic drugs, increased cognitive decline, increased behavioral symptoms associated with dementia, worsening of cognitive symptoms, worsening of dementia, reduction in independence of self-care, and there's continuity of medical care is diminished because of less likely to hire caregivers. Diagnosis of dementia, cancers, as well as other conditions like diabetes, hypertension is delayed because of the pandemic, and they're given less priority. It's young are prioritized more than the older individuals. And so what are we talking about? What generation are we talking about? We're talking about the traditionalists born between 1928 to 1944 and the baby boomers after the war. And most of them have some degree of independence. They value independence. They're workaholics. And the pandemic has caused them to be isolated at home. A lot of them should be staying at home. And these led to cognitive impairment and depression in this population. In early life, the goal is growth and development, but in adult life, our goal is to maintain highest level of function. And in older adults, what they want is you achieve independence, then you achieve independence for a prolonged period of time until you become frail, then you become disabled a short time until your life ends. But in some individuals, there's accelerated aging wherein functional reserve drops quicker. So they become frail for a prolonged period of time. They become disabled for a longer period of time until they die. And this is associated with poor quality of life. And this functional ability as you get older will really drop. But because of COVID-19, it increases the decline. It makes it sooner rather than later in this population. Somebody who gets admitted, it's harder for them to get back to their previous level of function. And and this is frailty. It's a reduced strength of and physiologic malfunction that increases an individual's susceptibility to increased dependence, vulnerability, and death. So you have somebody who's robust, then somebody's pre-frail, frail, then until they become disabled. But before they move from one part to the next one, you have stressors that happen like hospitalizations. They get adverse reaction to a medication maybe, or they have a fall, they have a fracture. So it lowers their quality of life. So are senior citizens too frail or weak to get COVID vaccines? First, you have to understand who are the highest risk of getting a bad, severe, critical COVID-19 infection. It's obviously the senior citizens. So if somebody were to benefit from vaccines, it's really this population. So in this study from the UPPGH from Dr. Shelley de la Vega, they said that 15% of those who participated who had COVID infection were 80 and above. However, a lot of them were not frail. 19% were robust, but a lot of them are pre-frail. So if you have pre-frail, yung risk of becoming frailer is much higher. So what do we want to achieve? We want to achieve healthy aging. It's a process of developing and maintaining the functional ability that enables well-being in older adults. It looks into the life course perspective, accumulation of strengths and deficits across the lifespan, and functional ability and intrinsic capacity and environmental factors play a role in all these things that makes us age healthy or successfully. And these would include things that you do at home, how you maintain social life, and you have sense of self, and you have support teams that help you, and you optimize your own health. And we'll be talking about reducing non-communicable diseases like hypertension, diabetes, cancers, primary and secondary prevention. Primary prevention is you don't have disease yet. and you want to prevent having disease. And to achieve this, you want to do lifestyle intervention, even resistance exercises in the oldest old, like meaning above the age of 80, patients will still benefit from healthy nutrition, smoking cessation, moderate or no alcohol intake, and vaccination. And with secondary prevention, you already have disease like a stroke. You want to prevent another stroke from happening. You want to make sure that the sugars, the blood glucose are at goal. You promote diets rich in grains, vegetables, and nuts. You promote physical activity and manage other comorbid conditions. Medications have to be taken. The weight has to be normal for the person's age, and they have to have constant follow-up. I've seen a lot of patients wherein they'll not see a doctor for 5 or 7 years yung pinakamatagal. But then once you see them, they're extremely sick already. It's like napabayaan sila. So social support is important. Isolation increases death and dementia. Protection against violence and abuse, education and literacy, and elderly participation in mentoring, visiting other people, volunteering. That's very helpful, but I know it's very difficult during this time. Accessibility and having the right amount of space to be able to function, exercise, and maybe walk. And the risk of COVID-19 infection, severe COVID-19 infection, is high. As you can see in this study, those 80 and above, as high as 20% of them died. And in the Philippines, 81% of the deaths were 65 and above. And in somebody who's senior, most of them will have a lot of comorbid conditions. Marami sila ibang sakit. So in this study, you'll see that in this sample of older adults who got COVID-19 infection, a lot of them had hypertension, 16% of them had diabetes, 10% of them were smokers, and 15% were already dependent, maybe bedridden or need some help with their activities of daily living. So when you get post-COVID conditions or long COVID or the post-acute sequelae of SARS-CoV-2 infection or post-acute COVID-19, na you get discharged from the hospital, magaling ka na, there are a lot of issues in our senior citizens. So there's psychological issues because a lot of them had a loved one or maybe a spouse who died because of COVID-19 because it happens in cluster. So grief, depression is very common. Post-traumatic stress disorder, that they've been in the hospital by themselves, being unable to communicate with their loved ones. Insomnia, some of them develop delirium, poor memory, and maybe it's a sign of early dementia. And still, a lot of them have physical symptoms after COVID. Some of them have shortness of breath, fatigue, joint pains, appetite is poor, they become frail, or headaches. So these vulnerabilities in environment were aggravated by COVID. The social support was less because relatives would usually visit their loved ones less because of the risk of them getting COVID-19 infection. Abuse, low education, lockdown, poor accessibility to health and vaccine centers, and lack of a safe space to walk and be active. And sometimes they're neglected. Sometimes they're discriminated on, like sasabihin mo na matanda ka na, so you have to stay at home, or matanda ka na, hindi mo na kailangan magpabakuna, which is a form of discrimination. And remember, this population is the one that will be most benefiting from these vaccines. So the benefits of vaccination is to reduce risk of disease, complications, and death. It may help them continue to work if the government allows it. The protect others around them, like their spouses or other people around who live with them, attain healthy aging. And when you give when you get COVID-19, functionality drops, but then if you give vaccine, maybe COVID-19 doesn't happen and you sustain your functional ability. There's no loss of function. And remember, COVID-19 could also present with other thrombotic events like a stroke or a heart attack, which might make the individual debilitated. And there are a lot of challenges. There's a lack of trust in vaccine safety, mga fake news, conspiracy theories, ayaw daw na anak kasi matanda na, which is a form of ageism. Fear of needles. The doctors were also afraid to recommend it or did not recommend it. And ageism. And remember, because they're at higher risk of getting bad COVID-19 infection, they're the best candidates to get COVID vaccinations, especially if they have comorbid conditions, hypertension, diabetes, heart disease, chronic lung disease, and generally they are safe and any brand recommended should be okay for our senior citizens. They do not need to get clearances from their doctors to get vaccinated, unless maybe if they have immunocompromised host. So apat dapat, always have to tell them, always wear face mask and face shield, physical distancing, air circulation, good air circulation, and limit the time interaction with their loved ones or any other people not from their household. Promote vaccination, and we promote healthy aging. And with that, maraming salamat po. All of us need to age gracefully as we get older, and I hope you learned something from this talk. Thank you.
Maraming salamat po, Dr. Hoven, for that presentation. Salamat po na binigyan niyo kami ng tips kung paano ma-achieve ang healthy aging at paano maiwasan ang iba't ibang uri ng sakit kahit pa 80 years old na hindi pa huli ang lahat. Maraming salamat po.
I just want to comment na una pasensya na it was in English. Pero I just want to point out na sa lahat ng population who will benefit from this, it's really the elderly population, older adults. Somebody who's young, yung risk mo of dying from COVID is lower than somebody who's much older. Remember, pag tumatanda tayo, mas marami tayong sakit usually kasi yung mga high blood, diabetes, usually nadadala naman natin hanggang pagtanda yan. So more medications, then yung risk of getting hospitalized, getting natutubuhan, na intubate, nadadala sa ICU is really high. And I've seen a lot of patients since I also work sa COVID wards na it's maawa ka sa kanila because they're by themselves. They become confused. They don't see the people that they get to see every day because yung relatives nila are also isolated at home. And I've seen a lot of patients na rin significant na dahil takot sila magpabakuna, maski kukwento ko na yung story na my uncle died from COVID and its complications, and it was tragic. Hindi ko pa rin ma-convince. Then their spouse who got vaccinated, sila hindi, will get COVID tapos mahahawaan sila. But then pagkausap mo through telemedicine, yung asawa nilang nabakunahan, after mga 3 days, 5 days, okay na, sila, it was really a prolonged course. You have to constantly follow up through telemedicine kasi bumabagsak ng konti yung oxygen. So there are a lot of things that happened, and lahat tayo in one way or another one was really affected by this pandemic. And yung sinasabi ko na sa pasyente is the moment you learn about this is if one of you gets affected, na sana hindi mangyari. Yung palagi ko sinasabi sa mga kamag-anak ko, which is syempre minsan matitigas yung ulo. They have their own mindset, they have their own things that they do on a regular basis. So tapos here am I, bigla akong magsasabing bawal lumabas, ayaw ng gobyerno, etc. etc. Then they don't understand because they don't see what suffering this virus does in at least the patients who get admitted to the hospital. With that, yun. Maraming salamat po, everyone.
Salamat po ulit, Doc Mark. At ngayon naman po para talakayin ang pagiging angkop ng ating mga COVID-19 vaccines para sa ating mga kapatid na Muslim. Nandito po ang representative na Secretary Saidamen Balt Pangarungan, Commissioner Yusuf Mando mula sa National Commission on Muslim Filipinos. Commissioner, nandito po ba kayo?
Yes po. Salam and good morning to all attendees. I am Commissioner Yusuf J. Mando. I will be delivering the message of Secretary Saidamin B. Pangarungan on his behalf. Message for the Resbakuna online webinar on today, July 28, 2021. Assalamualaikum warahmatullahi ta'ala wabarakatuhu. May peace and blessings and mercy of Allah be upon you all. Magandang umaga po sa inyong lahat. The Department of Health headed by Secretary Francisco Duque III through their Health Promotion Bureau has been actively promoting the national vaccination program against COVID-19 in pursuit of a pandemic-free Philippines under the Duterte administration. We at the National Commission on Muslim Filipinos have been involved in spreading awareness in the Muslim Filipino community through the regional and field offices, starting with the successful online activity held on March of this year. As the government rolls out the vaccine to include the senior citizens or the A2 priority group, the NCMF is again tasked or asked to assist in reaching out to the Muslim Filipino communities. Part of the Department of Health's approach in increasing public awareness is to tap the various faith-based groups in the country to assist in the national government's effort to promote and explain the COVID-19 vaccine. Because of this, the National Commission on Muslim Filipinos, under my supervision, had consulted with various ulama and imams in coordination with Bureau of Cultural Affairs and the Bureau of External Relations. Included in the list from the ulama sector who were consulted were representatives from the United Ulama and Imams of Region 10 Incorporated, Sheikh Ansari Abu Anas Abdul Malik, the National President of the Ulama and Imam of the Philippines Association, Dr. Alim Patani Abdul Malik, the late Ustad Ahmad Javier, Tawi-Tawi Provincial Mufti Abdul Wahid Injo, former Commissioner for the Ulama Sector Abdul Hadi Dagit, and NCMF Commissioner for the Ulama Sector Alim Jamal Munib. Based on their opinions about the vaccines, the NCMF would like to state the following in support of the efforts made by the Department of Health. The threat of the virus forced the immediate creation of a vaccine, with governments trying to provide vaccines supplies to most of the population. The Philippine government has been using a variety of vaccine brands on Filipinos, and we are slowly protecting the population, especially with the opening of the economy and the country's borders. Being vaccinated will not eliminate the risk of contracting the virus, but it will lessen the chances of developing severe complications to include death and the need to prolong hospitalization. Any substance that will effectively and safely protect people is considered halal in Islam, especially if it is the only viable option at present. The elderly are particularly at risk of contracting the disease and dying because of their compromised immune system. Therefore, we should be encouraging their vaccinations once available. Masjid administrators or the leadership in different mosques and imams are encouraged to regularly include in their Friday prayer schedules at least 10 minutes of discussions about the national vaccination program, the minimum public safety and health guidelines, and the role of the community in controlling the spread of the disease. The elderly jama'ah or the members of the congregation have to be protected, and the DOH needs support in informing their families about the availability of the vaccine and the benefit that can be gained from getting immunized. Being a senior citizen myself, I had gotten myself immunized during using Sinovac, and now I have the confidence to say that I had done my part as the head of the NCMF and as a law-abiding citizens of the Philippines. We must pay particular attention to the concerns raised by the senior citizens in our communities and correlate Islamic doctrines with our responsibility to the country, our fellow Muslim Filipinos, and our families. Just as we put our trust in the expertise of our religious leaders, we must also accept the expert opinion of the scientists and doctors working to eradicate the disease. The senior citizens have been placed a second priority only to the healthcare workers, which emphasizes the urgency and the need to vaccinate this population. Islamic teachers have said the obedience to those in authority is part of being faithful Muslim. And I urge all the Muslim Filipino families to at least listen to what the health expert of the DOH have to say about the vaccines and its effects on the elderly. Islam emphasizes the need to protect life, and the use of the vaccine and its timely distribution will help the entire world control the pandemic that has already claimed millions of lives worldwide, to include those deaths coming from the Philippines. The NCMF, or the National Commission on Muslim Filipinos, and the ulama sector support President Rodrigo Roa Duterte and the Department of Health in the government's campaign to proactively fight COVID-19 through vaccination and increased public awareness. Maraming salamat po. Saidamin B. Pangarungan, Secretary, National Commission on Muslim Filipinos. Thank you.
Maraming salamat po, Commissioner. At salamat din po sa National Commission on Muslim Filipinos for taking the initiative para konsultahin ang mga iba't ibang grupo ng ating Muslim groups at imams para magbigay ng kasiguruhan sa inyo, sa ating mga kababayang Muslim na ang mga bakuna po natin ay halal at ang benepisyo na makukuha nito dito ay sa ikabubuti po ng lahat.
Maraming salamat po.
Salamat po. At ngayon po kasama na rin po natin dito sa call ang iba't ibang senior citizens group natin. Kasama po natin dito ang Senior Citizen Welfare Association of the Philippines, ang National Senior Citizens Assembly, heads of the Office of Senior Citizens Affairs or OSCA of the different LGUs in regions 9, 10, 12, Caraga at BARMM. Kasama rin din po natin dito ang mga heads of contact tracing program and local governance officers ng DILG from regions 9, 10, 12, Caraga and ng BARM. Ngayon po, para naman i-discuss ang advisories po on the vaccination on senior citizens. Kasama po natin ang National Vaccination Operations Center, si Dr. Kezia Lorraine Rosario. Dr. KZ.
Good morning. Can you hear us po?
Yes po, Doc.
Okay, good morning everyone. So, I'm Casey. I will be presenting to you in behalf of the National Vaccine Operations Center, and we will present to you some of the National Vaccine Operations Center's advisory and on our strategy on how we focus our intervention for the priority group A2. So the next slide will talk about the current data that we have on how fast we are rolling out our vaccination to priority group A2. So as you can see here, we have a target population of around 8.4 million senior citizens that we need to vaccinate across the country. And as you can see here, we have only vaccinated 33.6% of our priority group A2 with partial vaccination, or it means that for those that are requiring 2-dose series, no, nabigyan na natin sila ng at least 1 dose. And for yung fully vaccinated, nabigyan na po natin sila ng at least we've given already to and covered 21.9%. So we're nearing at 22%. Next slide. So in the next slide, yung makita natin dito is the percentages, no, ng kailangan pa nating bakunahan with the first dose and those that already have received. So as you can see, the blue one talks about those that already receive at least 1 dose of COVID-19 vaccine, and the red one is the individuals that we need to cover. Looking at the regional level, no, we still need to cover a lot of population for us to complete the coverage for priority group A2. So marami pa po tayong trabaho to ensure na protected yung priority group A2 natin. So this data was as of July 27, yesterday po, 6 p.m. Next slide. And in relation to that, the next slide will show to you the completion rate, or the how many have, or how many percent have already received their second doses for the vaccines that needs 2-dose series. No, for Sinovac, since we are still ongoing, we've covered already, or 73 already completed their 2-dose vaccination. For AstraZeneca, since AstraZeneca has a longer interval po, it takes about 3 months, no, so for you to get your second dose of AstraZeneca vaccines, no, so much lower yung completion rate for AstraZeneca. However, later on, doon natin makita that we also would like to ramp up our second dose vaccination. It doesn't mean na missed doses po ito. It's just that most of them are waiting for their second dose vaccination. And ang kailangan natin is also to ramp up our second dose vaccination now with the threat of the Delta variant in the country. So these are also true with the Gamaleya vaccines and the ongoing Pfizer administration. And since we just administered our Moderna vaccines, then most of our priority group A2 are still waiting for their second doses as well. So those are the data that we have currently for the priority group A2. So some regions are faring well, some regions are lagging behind, but we want also not to have this uniform across the country that we can protect all of our senior citizens. So the National Vaccine Operations Center has provided guidance as early as April 29 on the vaccination of the priority group A2. No? On that pa po, no? Last April pa po tayo nagsasabi na kailangan natin ng more contextualized intervention when it comes to the vaccination of priority group A2. This is also true, no, when it comes to providing service delivery, ang paghatag og serbisyo sa mga katawhan, and then also in partnership with that, no, ang pag-mobilize nato, no, or pag-gather ng mga tao dito sa mga areas, no, sa mga communities, no, paano natin sila ma-encourage na magpa-vaccinate. So, as early as April 29, we encourage that the senior citizens can also be accompanied with at least one family member in the vaccination site. So, similar po ito, no, sa ginaingon nato na once magpabakuna ang senior citizens, ubanan po nato siya sa atong mga family members para dili kapuyon ang senior citizens, atong mga lola at lolo, at at least may kauban siya sa mga vaccination site, no, kung may kailangan siya, then ma-providean siya ng assistance dito sa vaccination sites. In relation to that, ini-encourage din natin na dun sa vaccination site, there are available equipments that will assist them, no? Like for example, there should be safe walking lanes. If there are assurettes that can be provided to assist them, if they are chairs, no, handbars and rails that will facilitate their vaccination as well, and if kailangan may wheelchair, then we provide it, no? And we also emphasize that kailangan talagang may priority lanes for senior citizens in the vaccination sites. Next, last May 27, this was also supported, no, with another advisory focusing on more ground intervention or social mobilization activities, and to find out other strategies to enhance the vaccination of priority group A2. Ang sinabi natin, no, that our hospitals and medical center can now start vaccinating yung mga dependents nila or mga family members who are part of the priority group A2. So, ma-protected din sila, no, since our health workers, sila yung pumupunta on the hospital on a regular basis, then they go home to their family members, and then if they are senior citizens, then they are at risk of getting COVID-19 then. So that's one of our directions. Next is to ensure na yung mga local government units has close coordination with the OSCA to ensure na alam natin kung sino yung mga senior citizens sa mga area natin, and they can be provided immediately with vaccination. Another emphasis was on the immediate scheduling, no, of all priority group A2. So ang kailangan natin gawin, ang ginaingon, no, ni Undersecretary Cabotaje, adtuon nato sa mga household nila, sa mga balay-balay, no, ikot tayo, no, sa mga household, then we ask kung may mga senior citizens ba dito sa mga household, and after that, kung may makitaan tayo ng mga senior citizens, then and then we can facilitate din yung vaccination nila at immediate pre-registration, no, sa mga vaccination site. So, importante din na we can also provide them with transportation, especially doon sa mga GIDA areas na walang mga transportation yung mga senior citizens natin, then they can also be supported, no, na magkaroon ng access for them to get vaccinated. Another thing what is also very important is also to give focused interventions when it comes to communications, no? So yung mga kailangan nating i-communicate, then we communicate it directly. So nakita natin na most of them will actually are more receptive when our family members are the ones encouraging us to be vaccinated. So i-influence natin yung mga family members, no? And as one family, then we can also prioritize kung may mga family members tayo na senior citizens, then pwede natin na unahin sila for vaccination with the support of the whole family. Slide. Okay. Okay, so for our next guideline, we actually released the Department Memorandum 2021-0286. So this guideline talks about the operational side of the vaccination rollout and how we can enhance, or what we specifically said was optimize our strategies for the priority group A2 vaccination. So you can access this guideline, and there you can see all the interventions that you can do to ensure that the vaccination rollout for priority group A2 in your areas are implemented accordingly. Next slide. Next, the NVOC is not only the ones who's focusing on the interventions to be conducted by our priority group A2. Even our vaccine cluster or Secretary Galvez have been seeing the vaccination rollout of the senior citizens, and siya mismo yung nag-e-emphasize that there should be interventions that should be implemented. So in this memorandum released by the National Task Force, Secretary Galvez sent a memorandum to Secretary Anyo emphasizing that each local government units, especially the barangays, should provide interventions for the vaccination of the senior citizens. So importante po, ang sabi niya, there should be exclusive lanes and exclusive time slots for senior citizens, and as well as communication to senior citizens must be done in an efficient manner, that kailangan silang at least mabigyan ng message, ma-Viber or ma-text, And then if hindi, we have our barangay health workers. We have been doing house-to-house interventions long before we had COVID-19, Kaya po yan na i-reach ng lahat ng DHW natin, At pwede po yung ma-communicate sa lahat ng mga community members ang information on health para po makaprovide tayo ng intervention. At saka in-emphasize din niya to create barangay assisted or pop-up site. So dapat ang mag-move talaga is the barangay to ensure that the senior citizens are vaccinated. Next slide. So in relation to that, memorandum number 8 also asked for supports from all the other national government agencies for the vaccination of A2. So another advisory that was released last July 15, more recently with the arrival of the Janssen vaccine, was on the vaccination rollout and utilization of the Janssen vaccine. So nakita po natin na even though we are ramping up yung vaccination activity sa buong Pilipinas, marami nang nababakunahan, but it seems na medyo slower yung pace when it comes to the vaccination of priority group dito tinututukan po natin with the arrival of the Janssen vaccine, since at least 1 dose lang po yung kailangan na ibigay for the Janssen vaccines, and then yung pag-manage ng cold chain ay medyo relatively similar lang doon sa mga other vaccines natin. Then this guideline said that the Janssen vaccine should be given to remaining unvaccinated priority group A2 and A3. This is also to ensure na mabigyan din yung mga high-risk COVID-19 and densely populated areas, and then to ensure yung pagbabakuna natin ng A2 and A3 in GIDA areas. Alam natin kung ano kahirap ang mag-vaccinate ng priority group A2 and A3 doon sa mga malalayong lugar. So with a 1-dose vaccine run, it would be easier for our vaccination teams to move from one locality to another. So yun yung ini-emphasize talaga natin for the vaccination of the Janssen vaccines. Now, our target for the Janssen vaccines is for us to complete the administration of Janssen vaccines at least until July 31. So in relation to that, we are also sharing with you yung contingency plan against new COVID-19 variants. So the national government, together with the other clusters, so we have the response cluster, we have the recovery cluster, and the vaccine cluster, are doing its contingency planning to ensure that we can manage the arrival of new COVID-19 variants, and also to ensure that if there are surge in COVID-19 cases, we can handle it in our own locality. While this is primarily the task of the response cluster, the vaccine cluster will also try its best to assist the response cluster in ensuring that the Philippines can manage po yung pag-vaccinate natin. Pag-handle ng COVID-19 pandemic. So we are sharing this to you so that yung collaborative effort will be similar in all of the levels of government, at saka ma-push din natin together with all our partners kung paano tayo ano yung direction ng gobyerno at saka ng bansa natin to ensure na ma-handle po natin yung pandemic. So for the vaccine cluster, the number one goal is really to protect the most vulnerable. So now we are, as mentioned kanina, we are doing all our best to sufficiently provide vaccines to all local government units for us to vaccinate the unvaccinated priority group A2 and A3. So the target is at least 70% coverage of priority group A2 senior citizens in all of the local government units. Yun yung target natin. And the next is to improve service delivery and increase access to the vaccination activities for priority group A2. So we're encouraging, in the guidelines, in the department memorandum, it's stipulated there how to deploy mobile teams and how to establish temporary posts in closed settings such as yung LGU na jails, nursing homes. Then you can follow all the steps and provide service delivery to more delicate senior citizens like yung bedridden, which needs in which the local government unit needs to deploy mobile vaccination teams. And next, however, hindi masyadong related sa A2, but then for the priority group A3, then we are also focusing on several comorbidities to ensure that they are fully vaccinated already. So these are those that are hypertensive, diabetic, those with tuberculosis, and those who are enlisted in the TB dot center, those cancer patients and HIV patients. Next slide. So the next slide shows the other interventions that the vaccine cluster will do. So for any high burden areas and surrounding areas, especially when there is a surge in COVID-19 cases, what will we do is we'll conduct catch-up vaccination activity in which we'll raise the target for priority group A2 higher. So with this, we want to ensure yung 100% coverage for priority group A2 and A3. And what we're doing is we're reserving vaccine doses for high burden areas so that once we foresee areas with high burden and those with increased cases, then we can deploy more vaccines immediately. So these are also some of our interventions. And next is to ensure vaccination administration on the second dose to all recipients of first doses. Ito yung sinabi natin na we need also to look at how fast and our vaccine recipients getting their second doses. So we're doing intensive catch-up activities, especially kung may mga missed dose. The missed doses are not really a problem as of now. Some are missing their doses because nagka-COVID-19 infection sila and they need to complete muna the 14-day isolation. And okay lang yon. However, we want to ensure that once they are ready for vaccination, then they can receive the vaccines that they need. And in coordination with this, we are doing our best to intensify our social mobilization activities and also our communications activities. And in relation to that, hindi na po to related for the priority group A2. Next slide, please. However, so that you can have a grasp of the whole concept on how we are assisting the response cluster when it comes to the COVID-19 variants, we want also to fast track the vaccination of the uniformed personnel, because the uniformed personnel will be the next in line support team, no, to ensure that the response when it comes to surges, no, may sufficient tayong tao to do all the response tasks. So we'll need the services of the AFP and PNP to assist us in the swabbing, in the transportation, in the quarantine facilities, kasi sila yung may mandate din to protect the people, so we'll facilitate them. So the move now is to ensure that they'll be vaccinated across the country, and that will ensure that sufficient vaccines are also deployed. This is in support and in preparation for any surge of COVID-19 cases in the country. So with that, now on the next slide, you will see also the advisory that was shared just 2 days ago on the AstraZeneca vaccines. No, while we advocate that at least vaccine recipients should receive yung second dose of vaccination nila immediately after 12 weeks, no? And we take also the recommendations na it would be optimal for our AstraZeneca vaccine recipients to have their second doses after the 12 weeks. But with the threat of the Delta variant, no, we are allowing our vaccination teams to give it as early as 8 weeks, which is allowed naman po sa emergency use authorization. To ensure lang po na at this moment, may second dose na talaga yung mga senior citizens natin. Next slide. So on the next succeeding slides, you will see we will share the presentation to you. I will not in detail explore to you the Tutok A2 strategies. You can run this over. These are also the interventions that have been emphasized over and over again dun sa advisory. So let's run through na lang po fast. So for the Tutok A2 strategies has several sections. First, on demand generation and communications. So we are balancing the act on ensuring that we have sufficient social mobilization activities and demand generation, as well as ensuring that we have sufficient service delivery. So ang sinabi natin dito, there should be continuous dialogue. That's why our DOH communications team are doing its best, to provide these interventions and to provide this venue to us to talk with you and to have this dialogue with you. And then also we encourage yung mga family members to ensure that sila din yung magpro-provide ng right messages to our senior citizens at mabakunahan na sila. Next slide. So another interventions or strategies are focusing on the pre-registration and master listing. Ito din yung nagiging concern lahat ng mga tao na because they say na nagpa-register na kami, hindi naman kami binabalikan ng vaccination site. So dito po magtatrabaho po tayo dito together with the barangay and also connect po dun sa vaccination site. So yung kailangan po nating mangyari is that lahat ng makita ng barangay na senior citizen, ito po ay dapat ma-communicate immediately sa vaccination site at mabakunahan na sila immediately din. No? Hindi na natin kailangan na ipabalik sila tomorrow kasi baka pag tomorrow na makalimutan na po pumunta ng vaccination site. Kung mahirap, sige, pwede. But kung pwede na today, then provide them the services immediately. So yung kailangan lang natin is immediate scheduling once we have identified our senior citizens. Next slide. So malapit na to. Few more slides. I'll ask Sarah to have it faster presented na lang. So with the access, we are also ensuring na may sufficient access lahat ng senior citizens. And the next slide, please. The next slide will talk about how we can improve our service delivery in the vaccination site. So here we are also encouraging and pointing out to deploy mobile vaccination teams for bedridden priority group A2, and then for local government units to establish temporary post-vaccination site. Anong ibig nating sabihin for temporary post? Yung temporary post po ay hindi siya constant na vaccination site, meaning doon sa mga areas na may maraming senior citizens like subdivision, you can open a temporary vaccination site at if maubos nyo na po yung senior citizens doon, pwede nyo nang i-close yung vaccination site na yon. So next slide. On the next slide, we will show to you the targets that we want. No, we have moved this target already kasi nakita natin na hindi pa ma-reach ng lahat ng regions. So as you can see here, ito yung tina-target natin na numbers na mabakunahan na natin dapat, no, before August 21. On the table, you can see na iba yung date, no? But then kasi we moved the schedules, no, and the targets since hindi natin then we expected na hindi na talaga siya ma-reach, no? So what we want to accomplish at least 95 coverage by the end of August, and on the other hand, for now, for our midterm goal, by the end of July, we're looking at least at 70% na mabakunahan na yung nasa NCR na priority group E2 and the rest of the regions, at least 40%. But then if we can provide them with, and we can cover more individuals or priority group E2, that would be better. We think that we can reach this with the sufficient amount ng mga Janssen vaccine na nakadeploy po sa ating mga vaccination site ngayon. Next, so ito yung sinasabi natin, no, we overemphasize this. Dapat na po na-rehistro na lahat ng senior citizen at na-schedule na sila. Tingnan po natin lahat ng mga barangays natin. Pwede kayong magpa-deploy ng mga barangay tanod nyo, mga BHW nyo. Tingnan nyo kung may mga senior citizens pa na hindi na-register at saka hindi na-schedule. If hindi pa po, i-schedule na natin sila ngayon so that kapag may vaccination activity na at saka may mga serbisyo na kayo, mabigyan sila immediately ng vaccine. Lastly, on the ways forward, these are the things that we are emphasizing, no? So what we emphasize first and foremost is 3 things lang. So 3 things. We recognize that each local government units have innovative ways to and determine innovative ways on how to vaccinate their senior citizens. Nakita namin when we do consultative meeting with the LGU, paiba-iba ang ganda ng mga strategiya. And the National Vaccine Operations Center will fully support yung pag-roll out ng mga different and innovative strategies. And then, we want to encourage yung house-to-house vaccination strategy, yung sinasabi ni USEC, implement a suyod team. Yung sinasabi natin, i-deploy natin yung mga barangay health workers natin, barangay tanods, para suyurin lahat ng houses, lahat ng mga household within the community to ensure talaga na protected na yung priority group A2 natin. And next is, how much we would like to increase and intensify our risk communication, this should always be supported by community organization and social mobilization. The power of the community is within the hands of the people sa baba, no? So ito yung word of mouth, yung pag-organisa sa mga assemblies natin sa komunidad. Alam natin, no, how we mobilize the community sa baba. These are very vital efforts. Hindi po kakayanin na lahat ng efforts nasa taas. Ang pinaka-powerful tool po natin ay nasa ground movement and how we involve each of our family members, each of the community leaders, each of the stakeholders on the ground to help us na ma-ensure yung protection ng priority group E2. So ito po yung message namin, and hopefully we can work together, no, at makita natin at ma-achieve natin yung mga targets natin. First and foremost, really, so that we can protect our senior citizens and so that they will we'll still have the time, no? So, kasi ang senior citizens, these are our family members. These are our fathers, our lolos, our lolas, our mothers, no? And our aunties and everyone. We need to protect them. They are the most at risk and they are the most vulnerable to have COVID-19. So, we want also na even though we have a lot of challenges, but we know our priorities, and that is we need to protect those that are most vulnerable and those that are at risk. And in behalf of Undersecretary Kabutahe, we thank all of the local government units, yung efforts ng mga barangay natin, ang efforts ng lahat ng organisasyon, ang efforts ng lahat ng mga stakeholders, mga CSOs, the private sector, and every one of us, no, in the health sector that are doing our job, no, to ensure and doing our best to ensure na maprotektahan lahat ng senior citizen. In behalf of the National Vaccine Operations Center, maraming salamat po. Thank you.
Maraming salamat po, Dr. KZ. Thank you for ensuring supply para sa ating mga A2 priority group or ang ating mga senior citizens, and for giving the guidelines po on logistics, ang sa mga mobile vaccination, suyod team, para masiguro at mapadali ang pagkuha ng bakuna para sa ating mga lolo't lola. Nais din po namin banggitin pala at pasalamatan ang mga active po na LGU Chief Executives na kasama po natin ngayong umaga. Mula po sa Tagoloan, Misamis Oriental, Mayor Gomer Sabio. From Baroy, Lanao del Norte, Mayor Rosa Olafson. From Lalad, Lanao del Norte, Mayor Angel Yap. Mayor Lorife Otaza. From Loreto, Agusan del Sur, Mayor Pachito Eguia. From Katipunan, Zamboanga del Norte, Mayor Glory Ferroa Clarin. From Misamis Occidental. Binabati rin po namin ang provincial, city, municipal health officers and information officers of the different LGUs in Mindanao na kasama po natin ngayon. At syempre po, yung mga napaka-active na nakikita po natin ngayon sa chat box. Pati na rin po yung sinabi nga po ni Doc Casey, sila ang mga powerful ground mobilizers natin, ang sangguniang barangay chairpersons and kagawads, barangay health workers at ang mga BHERTs ng mga different LGUs po natin sa Mindanao. Salamat po sa pagdalo at magandang umaga po. Ngayon po, bubuksan na po natin ang floor for the questions mula po sa Facebook, pati po dito sa ating chat box para sa ating mga experts. So kung meron pa po kayo mga katanungan or mga gustong i-clarify, pwede nyo pa rin pong ilagay sa ating chat box. So for the first question po natin, para kay Doc KZ mula po sa Facebook from Schumpert Iman, ang J&J vaccine po ba ay hindi pwede sa OFW? Priority kasi nila ang mga senior citizen. Pwede po ba nating i-clarify kung sino ang dapat po na maging recipients ng mga J&J na vaccines?
Hello, good morning once again. No, for the J&J vaccines, nakalagay po sa advisory natin that we are prioritizing po yung priority group A2 and A3 for the Janssen vaccines, no? Kasi ito yung easier to deploy to them. No? For OFWs naman, we allow actually other vaccines that can be given to them. We allow Sinovac, we allow Moderna, we allow Pfizer, we allow Gamaleya, and they can have all of these vaccines. No, whether it be from the COVAX facility, ang sabi nga ng WHO, we allow it to be provided via the OFW. Kahit COVAX, ito pwede po itong mabigay sa OFW. Pero po, with the Janssen vaccines, i-try po natin, no? Kasi ito po ay, ang hirap po magbakuna ng priority group ito. Let us give it to them po. Sila po yung at risk at most vulnerable as much as possible. We want po na itong mga bakuna na ito, because these are easier to deploy, ito po yung pwedeng mabigay sa mga lolo at lola natin. So, yun po yung magiging sagot namin, no, for that question. Thank you.
Nakikita ko rin po si Dr. Nina na naka-raise hand po.
Okay. Thank you, Dr. Casey. Maayong udto sa ating tanan. Yung pong ating mga COVAX donations po ng bakuna, ay stricto po sila kung kanino po pwedeng ibigay. So dagdag po na kaalaman po is yung pong ating COVAX, for example, na Janssen, na J&J vaccines, one shot lang po siya, ay talagang meant for our A2 and A3. Pero tulad nga ng sabi ni Dr. Casey, hirap na po yung ating mga seniors na pumunta din sa mga vaccination center. Kaya mas maganda po talaga sila po yung makinabang po doon sa one shot para hindi na po lisod kaayong maglakaw ang ating mga seniors papunta sa vaccination sites. So yung ating pong donations, stricto po yan kung sino po ang pwedeng makatanggap. Kasi pag na-violate po natin yung stipulations na yun ng COVAX facility, baka hindi na po tayo bigyan uli ng donated vaccines. So pangalagaan po natin yung mga stipulation po na kung sino po ang pwedeng makatanggap. Kasi pag tayo ina-audit, nako, lisod kaayo ng gihatag natin sa hindi naman eligible para doon po sa donated vaccines. Thank you po.
Thank you po, Doc Nina. And thank you for the clarification po regarding sa ating mga COVAX vaccines, ang mga donated vaccines po natin. Ang susunod na katanungan po for Doc KZ uli from Facebook, Parikoy Segira. Kailangan po ba ng vaccine ng mga security guards?
Yes, ma'am. Especially po yung mga security guards ng mga health facilities natin, no? Actually, kung security guards sila ng mga health facilities or mga establishments na nag-provide ng health services, bibigyan po talaga sila. Sila po ay nakasama po sa priority group E1 actually, no? So, like if ito po ay mga sila po ay mga security guards ng mga hospitals natin, no? Mga RHUs natin, mga isolation facilities, bibigyan po talaga sila immediately ng vaccines. Aside from that po, makakategorize na sila sa A4 if ever po. Over.
Thank you po, Doc KZ. This next question naman po is for Dr. Mark Hoven from Facebook user Jason Jacob. May mga gamot ba talaga para fully mawala ang comorbidities?
Good afternoon, good morning everyone. So medyo mahirap na sagutin yung tanong na yan kasi usually most of these comorbid conditions like hypertension, diabetes, cholesterol, etc. It's a lifelong disease. Hindi siya parang if you get pneumonia, I give you a 7 araw na antibiotics, you're okay na. And sometimes that's very hard for patients to understand. So for example, if nagbibigay ako ng pangpabagsak ng cholesterol, maliban sa numero na binababa yung cholesterol, may epekto siya na pine-prevent na yung heart attacks and strokes by about 50%. So 50% is a lot in somebody high risk, like somebody na mataas yung cholesterol tapos may diabetes din siya at the same time. Pero syempre, minsan, hindi mo makikita epekto ng umiinom ka ng cholesterol na gamot. Minsan nagsa-side effect ka pa, sumasakit yung mga kalamnan mo. Hindi mo nakikita epekto na, ay hindi pa pala ako na-atake sa puso, hindi ako nasa stroke dahil iniinom ko tong gamot na to. So, most of those medications, it's really lifelong. Pero syempre, it's very important to check na sumasangguni tayo sa doktor natin kasi, for example, for diabetes, pwede siyang pumapangit with time. Siyempre, may dietary factors, may other environmental factors, and by the course of diabetes, pumapangit talaga siya the longer you have the disease in majority of the patients with diabetes. So, siyempre, kailangan tayo nag-check every now and then para alam natin kung controlled ba o hindi. Kasi it's one thing to say you have diabetes, pero it's another thing to say may diabetes ka pero kontrolado. So, yung risk na komplikasyon associated with that, yung heart disease, etc., bumababa dahil kontrolado siya. So to answer the question is usually it's a maintenance. Hindi siya iinom ka ng 3 buwan tapos okay na siya, you stop it. Siyempre kung ini-stop mo, tataas ulit yung mga numero mo. Minsan nababawasan kung yung dietary intake natin, binawasan natin yung pagkain ng mga carbohydrates, significantly, minsan natatanggal. Or minsan, pwedeng matanggal completely kung hindi naman ganun ka uncontrolled yung diabetes natin. Or high blood. Minsan yung high blood, if you lose weight, bumabagsak rin yung blood pressure that you don't need to be maintained on maintenance medication, lalo na kung konti lang yung dose. Thank you.
Thank you po, Doc Mark. Our next question is for Doc KZ from Facebook, from Valse Minas Jim. Pwede po ba magpa-vaccinate ulit ng ibang brand ng vaccine after na-vaccinate ng Sinovac?
Good morning once again. So, sa guidelines po ng DOH, at saka yung mga protocols ng at saka yung sinabi ng FDA or doon sa emergency use authorization natin, wala pa po tayong policy na pwede na po tayong magbigay ng additional doses except that the one that has been provided to us na pwedeng i-administer, no? At those are only yung primary dose lang po na kailangan sa isang bakuna. So like for example, if you were given Sinovac po, bibigyan ka ng mga vaccination sites natin ng first and second dose ng Sinovac. Yung succeeding noon, wala pa po tayong policy noon at saka wala pa tayong sufficient data to support na kailangan natin magbigay, or there's safety studies, sufficient safety studies na po na magsasabi na kapag i-mix natin yung mga bakuna ay ito po ay safe para sa ating mga vaccine recipients, no? Our policy makers or DOH all expert teams and yung policy team natin sa Disease Prevention and Control Bureau are studying this as of this moment, no, and the National Vaccine Operations Center will fully support that, no, and will fully implement. Hindi pa po dapat magbigay ng iba pang bakuna, and this is also to ensure that the vaccines are also provided efficiently and equally to other eligible population. Very konti lang yung bakuna natin. Ang hirap makakuha ng bakuna, very few lang yung bakuna available in the country. And this should be provided equally, no? At least lahat tayo may protection at and then so therefore as a country we are all protected. Hindi lang po yung few, very few na makabenefit nito. And I think this can also be supported by Dr. Nina and all our experts here. They are the ones who's really closely looking at this one. Thank you.
Thank you, Doc KZ. Doc Nina, you have inputs also.
Thank you, Doc Casey. No? Tama po yun. Wala pa, ang tinatanong po ay mixing and matching. Siguro naririnig niyo po yun, nakikita niyo yun. Ano? Kulang pa ho ang pag-aaral. Tama po si Doc Casey doon. At ang problema din po ay hindi po siya pantay-pantay. Tandaan po natin, marami pa pong Pilipino ang ni isang bakuna ay wala pa po. So kailangan po natin ding isipin ang pagkakapantay-pantay po natin ng access sa bakuna. Kasi limitado pa po ang supply. Huwag po natin tularan yung isa pong politiko na nagyabang na siya ay nabakunahan na ng kung anumang brand yon, tapos nagpabakuna pa siya uli. Mali po yon. So karapatan po natin ang bakuna, karapatan din po natin na magkapantay-pantay po tayo ng access sa pagbabakuna at sa kalusugan. So antay lang po tayo kasi po talagang pinag-aaralan po ng mabuti, kulang pa po ang siyensya para mag-mix and match tayo. Hindi po siya safe kasi hindi pa ho sapat ang pag-aaral. Ingat po, baka yan na naman ay kasama dun sa infodemic natin. Kasi narinig nyo po dun sa isang politiko, mali po. Thank you.
Thank you, Doc Nina. Doc Nina, next question is for you from Facebook, Jason Jacob po ulit. Paano po kung yung BHWs or Barangay Health Workers ang mga nagbibigay ng maling impormasyon? Ano po ang payo po natin sa kanila at sa ating mga kababayan?
Maganda hong tanong yan. tandaan niyo po yung aking pulso framework. Kausapin po natin sila uli, turuan po natin, bigyan po natin sila ng access sa tamang impormasyon, kumbidahin natin silang panoorin po ang replay nitong ating pag-uusap na ito at marami pang webinar na nandun. So let us retrain our BHWs and share the correct information. Baka naman pong lang sila, yung access nila to correct information ay limitado. So ulit-ulitin po. Ang isa din po maganda, I'm a scientist po, no? And I will never say that what I say now, July 28, is the absolute truth. Kasi po itong COVID ay bagong pa lang pong sakit, so marami pa tayong pinag-aaralan at natututunan. So what we think now na tama, ay baka naman 6 months from now, pinalta na ho natin ang policy. Baka nalilito na rin po ang iba nating kababayan na bakit ang gobyerno papalit-palit, ang DOH papalit-palit. Kasi po ang siyensya ay umaabanse at na marami na ho tayong natututunan na kesa noon. Last year po, nung March 2020, nung start ng lockdown, masakit po sa amin sa UP College of Medicine. Nawalan po kami ng aming mga doktor. Yung akin po isang research partner na pediatrician, isa po sa mga unang doktor na namatay dahil po sa COVID. And now remembering the legacy of my colleagues na namatay. Sabi ko, if we only knew what we knew today, if we had the vaccine today, probably my colleagues would not have died. We would not have lost some of the best doctors of the country. So yun po, nag-e-evolve ang siyensya. At ang alam po natin ngayon ay maaari po magbago. Kaya we need to keep up. So kung mali po ang nakakadating na impormasyon, tawagin po natin, usap po tayo, review tayo uli. Manood po tayo ng maraming webinar ng DOH kung saan po nagbabahagi ng impormasyon. Doon din sa website ng DOH at saka sa Facebook page, sa YouTube channel, sa Twitter, tingnan po natin yung mga bago. Baka hindi lang sila up to date. Thank you.
Thank you, Doc Nina. For Doc Casey din po, again, from Facebook, Ernie Omapas and Roniel Sonsing. Pwede po ba magpabakuna kahit saang lugar? Mabagal po kasi dito sa amin, saka siksikan pa pag umuulan. Paano po ba magpapaschedule ng vaccine? Nagpalista na po kami pero wala pang schedule.
Good morning once again. So actually pwede naman po if you can access yung mga local government units na mga registration, no? But then we encourage po na doon tayo magpabakuna kung saan po tayo nakatira or saan tayo naka-work. Pwede po yun, no? Ito din po kasi yung allocation po natin, yung nakita na po, nag-prepare na po yung mga local government units natin kung ilan yung kailangan nilang bakunahan at napaghandaan na nila yung plano nila for the vaccination ng mga constituents nila. But if you have the option, pwede naman. Actually, ang principle lang naman talaga sa pagbabakuna is that the vaccination services, no, or activities should be accessible to anyone, no? Kahit saan kang lugar, like for example, bumisita ka lang sa isang local government unit, but then may bakuna na po, may bakunahan na po, pwede po kayong, dapat po, allowed kayong mabigyan ng bakuna kung saan kayo ngayon. But then, sir, no, you can also contact the COVID-19 vaccination NVOC, no, for us to assist you kung may mga nakikita kayong mga delay, especially sa mga registration, sa pag-schedule, inform us, sir. So, para ma-facilitate din namin, ma-inform namin yung LGU na yun na kailangan nating maging efficient sa mga serbisyo natin when it comes to vaccination. Kung nagpa-schedule na po tayo, dapat po may reply agad yung mga local government units natin. You can provide us po, no? You can send any queries, any concerns sa C19 Vaccine Option. I will type na lang po. No? We can receive all your suggestions, your concerns, and we will channel it accordingly so that din yung nationwide operations natin sa vaccination ay maging efficient din, no? across the country. Thank you.
Thank you, Doc Casey. Bago po tayo magpatuloy sa ating mga katanungan, nais din po nating batiin uli ang mga miyembro po at officers na kasama natin from the National Commission on Senior Citizens, representatives from PIA regional offices at ang ating mga local media partners na kasama po natin ngayong umaga. Okay, our next question po ay for our experts, Dr. Nina and Dr. Mark Hoven. From Zoom po, from the LGU of Tuburan, Pagadian City. Paano kung ayaw talagang magpa-vaccinate ng mga senior citizen kasi may sakit daw sila? Anong dapat po na gawin na nasa priority na hindi talaga magpa-vaccinate tulad ng mga senior citizens?
Thank you for that question, no, Dr. Halili. Actually, my aunt, 89-year-old pharmacist, lives in Iloilo in a small town. Kahapon lang po nagpabakuna. Hindi ko kinukulit yung tiyahin ko. Kasi ilang buwan ang dumaan. Sabi ko, hindi pa bakunado si tita. Hindi pa. So, hindi ko alam kung ano yung rason. Pero nung dumating yung one-dose vaccine, mukhang ginanahan yung tiyahin ko. So, kahapon po siya ay nagpabakuna. After so many months of waiting. At alam niya ang ginagawa ko for DOH na ito, for the bakuna, etc. So anyway, that's my personal story that I don't know what it takes to change the mindset, no? But also, yung people po around the seniors, yung mga anak, kapitbahay, yung pong nag-aalaga, sila po, importante po silang impluwensya. Kung sino po ang nakakakausap sa senior, sila po yung the best way para ma-reach po natin at magpaliwanag po uli. Kung sino po yung nakakahalubilo. Sometimes it just takes somebody else para lang makumbinsi sila to share experience. And I'm sure Dr. Hoven will share the same thing ng coming from a fellow senior citizen like Attorney Quijano, perhaps telling his story, mas convincing yan ng pagbabakuna, etc. No? So, from somebody who looks after them, kung mag-isa lang po sila, unfortunately po, hindi po lahat ng ating seniors may kauban sa balay. Kung mag-isa lang po siya, naayos mo siguro yung mga kapitbahay, mga agaw, so churchmate. So yun po ang pwede po nating kumbinsihin din yung kanilang kaibigan na senior. Dr. Mark?
Thank you po. I totally agree with what Dr. Karandang said. Usually kasi yung ganito, kaya sila hesitant is because either they read the news or yung kaibigan nila hindi nagpabakuna because of a certain reason. So the first thing we have to do is figure out bakit. Why are they saying no? Kung ang sinabi niya is dahil marami siyang sakit, then we have to explain, ikaw nga yung at risk, magka-COVID Kung lumabas ka lang ng bahay mo, tumawid ka at sinubukan mo hindi magsuot ng mask, yung risk of getting COVID is very, very high. And the risk of you getting to the hospital if you get COVID is much higher than somebody who's much younger. So, kailangan lang natin i-explain kasi for example, the patients I see sa clinic, siguro 50-50. Ngayon, sa Manila ako nagpa-practice, so 50% will be vaccinated, 50% hindi. Tapos yung 50% na hindi bakunado, you ask them about reasons, they will give you reasons about may diabetes ako baka hindi ko makayanan or they mag-share sila ng story ng kakilala na when they got vaccinated, nilagnat. Sabi ko, yun naman talaga yung side effect ng gamot. Alam naman natin, pwede tayong lagnatin pag nabakunahan tayo. But it doesn't mean hindi dapat tayong magpabakuna. Para siyang seatbelt. Nagsuot tayo ng seatbelt, we prevent dying from accidents. Kung ma-aksidente tayo by 50% at least. And here you have a vaccination, lumabas ka lang, yung risk of getting COVID is high. It reduces significantly to get severe COVID, 90+%. So, magandang datos yun para makumbinsi yung isang taong magpabakuna. Yun lang, yung fake news, I think it's the one causing all these issue. Magpupunta ka sa internet, sa Facebook, may makikita kang somebody preaching about vaccines na hindi naman nila alam what they're talking about. They just base it on a news na hindi reliable. So, ang duty natin as healthcare providers is to educate our patients. Alamin muna natin bakit, tapos explain natin in our own words bakit nila kailangan. Kasi, syempre, sila ang at risk. Thank you.
Thank you po, Doc Mark and Doc Nina. Ayun, meron nga pong nagko-confirm na usually nga daw po natatakot dahil may mga relative na nagkakaroon ng sakit tapos ang vaccine ang biniblame. Now, before po we continue with our Q&A, bibigyan po natin ng time muna ngayon to give a message po sa ating mga barangay, ang ating Undersecretary for Barangay Affairs from the DILG, Yusek Martin Dino. Yusek.
Okay na. So sige lang, mauna na kayo. Una sa lahat po ng mga na nakikinig ngayon at nanonood, lalong-lalo na sa 47 barangay. Unang-una sa lahat, malaki po ang ating magiging papel dito sa ating information campaign para kay Lola at kay Lola. Barangay lang po ang may kapabilidad na mapuntahan natin ang mga lolo't lola sa mga bahay. Sanay na tayo dito, lalong-lalo na ang mga barangay health worker. Ito na yung ating ginagawa, time and memorial. Pagka naghahanap tayo na may sakit, may lagnat, ito ang ginagawa ng mga barangay health worker. At alam natin ang terrain ng barangay. Kaya ito po ay maglalabas tayo ng memorandum circular na meron po tayong gagawin na kung saan babahay-bahay na po natin ang ating mga senior citizen. Lalong-lalo na po yung mga hindi na nakakalabas ng bahay. At kanina may tanong kung daw may misinformation na gagawin ang mga health worker. Wag po. Dahil pwede kayong makasuhan pagka nalaman namin na merong barangay personnel na nagpapakalat ng maling impormasyon, pwede po kayong makasuhan tungkol dyan. Wag po natin gagawin dahil unang-una, buhay ng tao ang ating ililigtas dito. Sa kasalukuyan ngayon, dito sa Maynila, kahit na po umuulan, bumabaha, nakapila ang mga mamamayan para mabakunahan. Dahil dito sa Delta variant na to. Kaya nga kahit nasa probinsya, wag na po nating intayin na dumating sa ating doorstep yan. Ang pinakamagaling na bakuna po ay kung anong bakuna ang nasa harapan ninyo. Yan ang pinakamagaling na bakuna. Ako po, hindi kami namili at marami po akong kaibigan na nag-intay, namili ng babakuna. Kaya lang, naunahan po sila ng COVID-19 at ngayon, wala na sila dito sa ating mundo dahil nag-intay pa sila. Kaya ang aking pakiusap, lalo-lalo na sa ating mga kabaranggayan, pangunahan po natin dahil ang tanging solusyon dito sa COVID-19, huwag na tayong maraming dahilan dahil unang-una po, buhay ninyo at ng inyong pamilya ang ating pinag-uusapan dito. Kaya ho, again, wear your face mask, face shield, health protocol, social distancing, at kahit na nabakunahan, gawin natin ito. Again, ang aking pakiusap, puntahan po natin ang ating mga senior citizen dahil alam ko, 13 taon akong kapitan. Alam na alam ng ating mga tanod, barangay health worker, kung nasaan ang mga senior citizen sa barangay. Alam ni Kapitan yan, alam ng mga kagawad yan. Wala kayong may tatago sa akin dahil 13 taon ako dyan. Kaya sabi ko nga, walang pinakamagaling na contact tracer. Kung hindi ang barangay, gamitin natin ang ating pagiging chismoso at chismosa. Pag may inubo, merong nilagnat, alam nyo na kung anong gagawin. So sa inyo lahat, maraming salamat sa inyo. Ito ang inyong Undersecretary for Barangay Affairs, Martin Dino. Mabuhay ho at 101% natutulong kami at aalalay dito sa ating programa para mailigtas natin ng ating Lola at Lolo. Salamat po. God bless us all. Okay, thank you.
Thank you, Yusek Nino. And bago po tayo pumunta sa ating susunod na tanong, pinabati rin po natin ang commissioner po ng National Commission on Muslim Filipinos, Commissioner Samer Along Hasanal, Datu Mama Sinsuat Jr., ang Regional Director po of NCMF sa Region 12, at representatives from NCMF regional and field offices po all over Mindanao. Our next question po ay for Dr. Casey from Zoom, Juana Fantilanan. Good AM, ma'am. Ask lang kami regarding sa number of weeks para sa second dose ng AstraZeneca. March 27 ang first dose and second dose July 27. Dapat 8 weeks lang. Clarification lang, ma'am. Thanks. Doc, if we can clarify lang po ang allowable interval for AstraZeneca vaccines.
Good morning once again. For the AstraZeneca interval, wait lang, nag-feedback kami. For the AstraZeneca interval, sa guidelines po natin ay nakasabi na ang interval ay 8 to 12 weeks. 8 to 12 weeks po yung interval natin for the AstraZeneca vaccines. No, actually, sa EUA, sinabi na okay to give at least 4 to 12 weeks. But nakita natin na mas mataas yung effectiveness ng vaccine if longer yung interval with the AstraZeneca. No? Dr. Nina and all our experts can elaborate on the technical side on this. No? On the operation side, we encourage them now na to ensure na if possible, no, we will maximize and optimize yung interval kasi nagsasabi na mas maganda yung immunity natin kapag mas mahaba yung interval. No? So before we encourage talaga to maximize the 12 weeks, we encourage na kapag nakuha niyo yung bakuna ngayon, at least magbilang kayo ng 12 weeks after, dun kayo magpabakuna for the second dose. However, ngayon with the threat ng Delta variant, we allow, no? Actually, allowed naman talaga siya. But then if our vaccination site will also facilitate na mapakunahan sila within 8 to 12 weeks, then that would also be okay. Kasi nagdidepende din yung service delivery mo. Minsan yung mga vaccination sites hindi din nagpo-provide ng vaccine administration kapag hindi 12 weeks. So we allow our implementers na we encourage them, you balance the situation in your area. Kapag tingin nyo na medyo mataas na talaga ang threat, then you can do it naman earlier as 8 weeks. Over.
Thank you po, Doc Casey. Our next
may I be
question.
recognized?
Yusek Marlo.
Yes, may be recognized. Para masundan ko lang yung sinabi ni Undersecretary Martin Dino kanina.
Okay pa, sige pa, Yusek.
Okay, thank you very much and magandang hapon po sa ating lahat, no? Hapon na. Pero nandito pa rin tayong lahat. So ibig sabihin lang na talagang interesado tayo na makapag-ambag, no? Ng ating small way in the realization of the national vaccination program. And I really, I learned a lot from the presentation of Dr. Carandang, Dr. Joven, and Dr. Rosario, particularly for all of us, to work together in making sure that we really achieve the objectives of the national vaccination program, particularly working as a whole of nation approach, in order to to reach out to as many people as possible. Kaya ngayong hapon na ito, ngayong araw na ito ay nagagalak kami na kasama natin yung ating mga local officials, particularly local chief executives, yung ating mga barangay officials, punong barangays and kagawads, even our barangay health workers and the barangay health emergency response team members. Nang sa ganun ay lalo nating maintindihan ang responsibilidad ng bawat isa. Pero ang pinakamaganda kasama natin ngayon yung mga senior citizens, no, Association of Senior Citizens. Nang sa ganun ay makatulong sa atin na maipahatid yung tamang mensahe sa mga senior citizens na nagkakaroon ng vaccination hesitancy. Katulad nga ng nabanggit po kanina, napaka-importante ng role or responsibilidad ng ating mga local government officials, no, particularly in reaching out to our senior citizens. And towards this end, ang aming pong kagawaran ay nagbaba ng mga iba't ibang direktiba nang sa ganun ay lalo pang mapaigting ang pagpapatupad at pagsasagawa ng ating mga local government units ng kanilang responsibilidad, ng kanilang ambag, no? Nang sa ganun ay maprotektahan yung ating mga mamamayan, lalo na yung mga vulnerable sectors. Actually, nandun pa sa isang direktiba namin na we encourage, no, we enjoin our local officials to post in their personal Facebook account or in their official Facebook account, no, not only our local officials but also respectable members of the society, pictures, no, when they were vaccinated, yung pag-post ng kanilang mga larawan nung sila ay tinuturukan na ng vaccines. Nang sa ganun ay we can take advantage of the social media in sending the right message to our people, particularly sa senior citizens. Kasi nga nakikita naman natin, alam naman natin na ang mga senior citizens na ito ay siguradong may mga kasambahay na mga teenager o na mga adults na may mga Facebook accounts or Twitter account. At kung ito ay ma-access ng kanilang mga kasambahay, lalo na yung mga bata-bata, ay pwede nilang maipakita sa mga senior citizens, no, na nag-aalinlangan na magpabakuna. Makikita nila na yung kanilang mga local officials, yung mga kasama nila ng mga senior citizen ay nagpapabakuna na. So these are some of the directives that we have given to our local government units for us to reach out to our senior citizens. But more importantly, no, sa tingin ko kasi equally important as sending the right message is for our local government units to make it as convenient as possible for our senior citizens to have the vaccine. That is why we have enjoined our LGUs to set up a very good system in their vaccination program. Nung isang linggo ay kasama namin si Mayor Ann Petilla ng Palo Leyte, isa sa guest doon sa radio program namin, at nabanggit niya na doon sa Palo Leyte, no, pag pumunta yung isang senior citizen na magpabakuna, it will not take him or her 1 hour to be vaccinated. Why? Because they have already set up the necessary system, the proper system to cater to the needs of our senior citizens, particularly yung mga matatanda. Kasi alam naman natin na may iba't ibang karamdaman, no? May mga inconveniences na nararamdaman ang mga yan, ang ating mga lolo at lola. Kaya kinakailangan ay mabigyan natin sila ng karampatang atensyon. And this would already be done by our local government units. Sa tingin namin, no, sa panahong ito, sa araw na ito, dapat nakaset up na yung ating mga LGUs ng kanilang magandang sistema. Why? Because we've been doing this for like 3-4 months, and by now we should have already identified kung ano yung mga diferensya dun sa sistema na pinapatupad ng ating local government units. So at this time, it is good that we have our local officials with us. And by the way, no, we salute you, our local officials, our local government units, for the effort that you put into your work. And we know that generally you are doing good, but we can still improve, no, on how we do things. And that is the reason why ginaganap natin itong mga pag-uusap, pakikipag-usap sa inyo nang sa ganun ay lalo pa nating maintindihan kung ano yung nararapat na gawin ng ating mga local government units nang sa ganun ay matugunan natin yung pangangailangan ng ating mga vulnerable sectors, particularly our senior citizens. A while ago, I saw in the presentation yung iba't ibang estratehiya in order to convince our senior citizens to avail of the vaccine. At nakita ko yung peer pressure. I think this is a very good strategy kasi kung may peer pressure para dun sa mga teenagers, for them to stay away from drugs, from teenage pregnancy, we can also use this peer pressure for senior citizens in order to encourage their other fellow senior citizens to avail of the vaccine. But I think importante rin na maintindihan ng ating mga senior citizens na pag nagpabakuna sila, hindi lang para sa kanilang proteksyon, kundi para sa proteksyon na rin ng kanilang mga mahal sa buhay, kundi proteksyon na rin sa kanilang komunidad. At kailangan din na siguro malimi nila na pag nagkasakit sila ay malaking abala, malaking pangamba, pag-aalala para sa kanilang mga mahal sa buhay. At alam naman natin na one way or another we have been sick in the past at alam natin kung ano yung feeling pag nagkasakit yung ating lolo at lola, kung nagkasakit yung ating mga apo, talagang nag-aalala tayo. So yun pa yung isang iisipin ng ating mga kasambahay, how can they take care of us when we are infected with virus. So I do believe we will issue a memorandum to our local government units encouraging them to announce in their LGUs or in their areas of responsibility that they can access these sessions through the website of the DOH and other platforms. Nang sa ganun at ay kung may mga pag-aalinlangan lang hindi lang ng ating mga senior citizen kundi na rin yung mga iba't ibang sektor, priority sector ng lipunan ay pwede nilang maipakita ito, maipalabas at para malunasan kung ano man yung pag-aalinlangan, kung ano man yung mga agam-agam na nararamdaman ng bawat isa. So muli, maraming salamat and we salute everyone for staying up to this time. 332 participants still. And we look forward to more sessions with our citizens and our local government units. Thank you very much.
Thank you so much po for your message. DILG Undersecretary for Local Government, Yusek Marlo Iringan. Okay. Our next questions po are for Yusek Verheire from Zoom, from user Barangay Bernard. Ang vaccine po ba ay kailangan po ba since ito ay hindi naman mandatory pero ang approach mostly needed talaga? Pwede po ba natin gawing compulsory at pilitin ng mga senior citizens na magpabakuna?
Yes, salamat Casey at salamat po dun sa tanong na yon. Ang mga bakuna po natin sa ngayon ay hindi po mandatory. Ibig sabihin, this is purely voluntary. So bakit po ba ganito ang ating approach or strategy? Unang-una, ang mga bakuna po na atin pong itinatalaga at binibigay sa ating mga kababayan, even across the globe, ay lahat po ay nasa Emergency Use Authority level. So pag sinabi nating EUA, it has not completed the complete phases of a clinical trial, but experts have already evaluated and has given that go signal na pwede na nating gamitin dahil nakapagpakita na ito ay safe at ito ay magiging epektibo sa ating populasyon at sa populasyon sa buong mundo. Ang isa na lang pong inaantay na phase 4 clinical trial habang nasa EUA po ay ginagawa na rin po nila because that is post-marketing surveillance. So hanggang nasa EUA po ang isang bakuna, hindi po natin pwedeng imandato ang ating pong pagbabakuna sa ating mga kababayan. It's going to be voluntary at bibigyan kayo ng tinatawag na informed consent. Kaya kung mapapansin niyo po pag dumating kayo sa mga bakunahan, meron ho kayong pipirmahan na ang tawag ng marami ay waiver. Ito po yung informed consent kung saan nakalagay po dyan lahat ang benepisyo ng pagbabakuna at ano naman po yung nakalagay na risk para po pag kayo nagpabakuna. Like pwede kayo magkaroon ng reaction na minor, kung sakaling magkaroon kayo ng allergies, nakahanda po ang ating mga bakunahan na bigyan kayo ng karampatang lunas. So pag nabasa nyo na po yan at naintindihan nyo na at naipaliwanag din sa inyo ng healthcare worker, kayo po ay pipirma na for that voluntary consent para po kayo ay bigyan na ng bakuna na ito nga pong mga bakunang meron tayo with EUA. So para sabihin po na gawing compulsory, wala pa po tayong pwedeng gawing basihan for this because we know that every person has a right to choose kung ano pong klaseng medical service o anong klaseng anong klaseng management sa kanila at yan po ay nakalagay dun sa ating saligang batas. So sa ngayon po atin pong pinapakita or pinapatupad itong voluntariness nitong pagbabakuna. Our approach really is to say and tell all of you, this is very important. Kailangan po natin maintindihan, aside sa mga ginagawa ho natin mga safety protocols, katulad ng pagmamas, pag-face shield, physical distance, yung 4 dapat, kailangan pa ho natin yung additional na layer of protection for all of us. And that would be the vaccines na meron tayo sa ngayon. Ito pong safety protocols plus bakuna is guaranteed to protect you from this COVID-19 and its variants of concern. PC?
Thank you, Yusek. Our next question po, actually, last 2 questions because overtime na po tayo. Yusek, it takes time to get the results of a genome profile. Are there plans by the DOH to purchase additional units in preparation for the new strain and distributed by regions?
Yes po, no? When it comes to whole genome sequencing, ang atin pong Philippine Genome Center sa ngayon, meron po tayong 7 klaseng makina sa PGC. Ang ginagamit po natin ngayon siguro ay mga 3 o 4 na makina dito sa 7 makina na ito. Kailangan po natin maintindihan the process of genome sequencing is highly technical. Ibig sabihin, kakailanganin po natin ng mga healthcare workers na highly technical, katulad po ng mga molecular biologists, aside from those bioinformatics technical people. So ito po mga prosesong ito ay kailangan po talagang natitrain ng lubos ang ating mga hahawak ng makina at mag-a-analyze nito mga ginagawa nating proseso for whole genome sequencing. Our plan at this time is to expand our capacity. Una, dito muna sa Philippine Genome Center. That's our low-hanging fruit. Ibig sabihin, yun pong ating output ngayon, we have 750 samples per week na itetest natin. Maari po nating madoble yan sa 1,500 per week kung tayo po ay makaka-receive na nitong extraction machines na kinakailangan nila, automated, para bumilis po ang proseso. Aside from that, meron po tayong forward plans kung saan nakikipag-usap na po tayo sa Department of Science and Technology and UPNIH with UPPGC para ma-expand po natin ang genome sequencing processes sa UP Visayas and UP Mindanao. So ito po ay pinag-uusapan natin, tinitignan na lang natin kung ano pa ang kailangan ng mga laboratorio dito sa UP Visayas and UP Mindanao. And of course, we need to identify yung pong mga pondo na kakailanganin natin so we can start already processing doon po sa UP Mindanao na mas malapit po sa inyong lahat.
Thank you, Yusek. And for our last question po, Yusek Rosette, ano po ba ang mangyayari if merong magpabakuna ng first dose pagkatapos ayaw na magpa-second dose?
Wala. Una-una, pag tinignan ho natin ang mga ebidensya all over the world, nakikita ho natin, doon pa lang sa clinical trials, yung efficacy data ang tawag dyan. Kapag unang dose pa lang ang nakukuha nyo, mababa pa ho yung efficacy na binibigay sa inyo. It means mababa yung protection na naibibigay sa inyo ng bakuna. Doon naman sa real world effectiveness kung saan pinag-aralan na po doon sa mga taong binibigyan na talaga ng bakuna among the population, ganun din ang ipinakita. Kapag unang dose pa lang po ang binibigay sa inyo, hindi pa ho yung full protection. Halimbawa po, sa isang bakuna type A, kapag kayo ay binigyan ng first dose, you can get maybe efficacy of 50 to 60%. Pero kapag binigay na sa inyo yung second dose, tumataas hanggang 90 to 95% ang efficacy. Ibig sabihin, 90 to 95% protektado kayo against COVID-19. So pag nireceive nyo ho yung first dose nyo, you don't get the full protection na ibibigay dapat sa inyo ng bakuna. Sinasabi na ho ngayon, base sa mga ebidensya at ng ating mga eksperto, for you to be able to get protected, especially of this from these variants of concern, katulad ng Delta variant, kailangan full dose po, 2 bakuna ang ma-receive nyo para kumpleto ang protection at kayo po ay makakaagapay, no, dito po sa COVID-19 na meron tayo. Pinapangako po ng mga bakunang ito na kayo ay maililigtas ng malaki, no, the risk of getting severe infections, being hospitalized, and dying from COVID-19 is reduced tremendously when you get 2 doses or full vaccination, full doses of your vaccines. Pwera na lang, ang Johnson & Johnson po na bakuna, single dose lang po yan. So makatapos po ang 2 linggo at mahigit pa ng pagkakabakuna nitong single dose na Johnson & Johnson, you get your full protection also. PC?
Thank you po, Yusek. Ngayon naman, that ends our open forum. Now, may we ask a short message from our resource persons and our experts today. Unahin na po siguro natin our NITAG expert, Dr. Nina Karandang.
Magandang hapon po. Hapon na, no? Nagsimula po tayo, umaga pa, hapon na. So ito na po siguro yung pinakamatagal na webinar ko in the past week, no, Yusek. Inabot tayo ng 12:30, no? Usually by 12, tapos na. Paalala lang po, alam ko pong inip na po tayo and we've been on lockdown for over 500 days na po. Ganun na po katagal. Pero the consistent and proper use of face mask and face shield, hindi po kwintas ang face mask, hindi din po headband ang face shield, physical distancing pero socially connected po tayo, good ventilation, yung maganda po ang flow ng hangin, limited time of face-to-face interaction, wag po tayo masyadong matagal makipagtsikahan ng face-to-face sa ating mga kaibigan kamag-anak. Lahat po yan, plus yung protection po ng bakuna, pag pinagsama po natin yan lahat, ay mas maganda pong panlaban sa COVID-19. Huwag din po tayo maging biktima o tayo ang mambiktima ng iba dahil sa maling impormasyon na ating isi-share, ilalike, i-video. Ingat po tayo. So good information hygiene po. At ang lagi kong tanong, kumpleto pa po ba ang inyong mga daliri? Kumpleto po lahat ng aking daliri kasi hindi pa ho napuputol sa pag-share ng maling impormasyon. So sana din po kayo ay 10 daliri pa rin po kayo by the time na makalabas po tayo sa pandemya. Thank you very much.
Thank you so much po, Dr. Nina. Our next naman po,
so Dr. Halili, 10 pa ba daliri mo?
10 pa naman po ata.
Si Yusek natawa-tawa. So siguro siya 11.
Baka po ako pagalitan ni Yusek pagka nabawasan po. Ang susunod naman po natin na magbibigay ng short message from the Faculty of Medicine and Surgery ng University of Santo Tomas, Dr. Mark Henry Hoven.
Hi, good afternoon. What's being said, yung mask, you have to really wear mask. Right now, nasa clinic ako, naka-mask ako. And I actually wear double or sometimes triple mask kasi natatakot ako. Even if I get vaccinated, I can still infect other people. And the patients I see kasi, yung mga elderly, are seniors, they're really the persons at risk for getting bad COVID infection, ma-admit, ma-intubate, and a lot of them will not make it. Kung na-admit ka sa ICU, yung risk of dying is extremely high. And even with the medications that we're giving right now. And itong vaccine is a way for us to reduce that risk dramatically in this age group.
And syempre, maraming uncertainty, maraming fears, maraming hindi natin alam ano kayang epekto ng bakuna sa akin. So siguro what I tell patients is para lang siyang yung you get vaccinated for the usual, yung mga measles, rubella, things that we had in the past. And these are technologies that pinag-aralan naman yan. Maski sabihin mong it's emergency siyang ginawa for this pandemic. The technology was there way back. It was just utilized around this time. So yung benefit niya dito sa our senior citizens, our parents, our grandparents, to prevent them from getting bad disease is really high. So as healthcare workers, we have to do our part. We have to avoid yung nakita mo na nga parang may mali dito sa news, shinare mo pa kasi interesting siya. Maganda yung title. But if you look at what's inside, parang it just confuses other people. We have to do our part because majority of the patients I see sa clinic, kung aalamin ko bakit ayaw nila magbakuna, by the time they get out of my clinic, I'm able to convince at least 80% of those unvaccinated who come to the clinic to get vaccinated. So 80% is still a lot. So, and I think all of us have our own patients and can convince our fellow Filipinos to do their part and get vaccinated. It protects you, it protects your loved ones, it protects your neighbors. Okay, yun lang. Salamat po.
Thank you, Dr. Mark. Next po would be a short message from the National Vaccination Operations Center, Dr. Keja Rosario. KZ.
Hello, good morning. Once again, good noon na pala, 12 o'clock na. In behalf of the National Vaccine Operations Center, we thank all our local government units, no, especially yung mga barangay sa lahat ng ginagawa nila ngayon when it comes to the pandemic response and as well as ensuring na lahat ng constituents natin na babakunahan. Especially yung pag-prioritize natin sa mga health workers natin, sa mga senior citizens at saka those with comorbidities. Tandaan natin, no, nagbabakuna po tayo ngayon para po first and foremost i-ensure natin po yung mga most vulnerable at saka yung most at risk na magkaroon ng protection na when it comes to pandemic, no? And in-emphasize namin, these are our loved ones, our family members, and part of our communities that if mawala po sila sa atin, it will cause us tremendous emotional and mental grief, no? So ini-encourage natin na sa panahong ito, tulungan po ito, no? It's not the task lang of the Department of Health, it's a multi-agency task together, no? At the national level, we work hand in hand with all the national agencies, no? The DILG, the SWD, the AFP, PNP, all of our sectors na involved in this vaccination campaign, as well as, no, in respect with the Republic Act 7160, we have delegated all of these responsibilities also with the local government units, and our local government units have been performing well, and we are very thankful for the services na pinoprovide ng mga local government units natin, and we cannot also do this without the support ng mga private sector natin, mga social workers natin, mga barangay health workers natin, and all those stakeholders na involved po sa bakunahan. So kung makita po natin na it's a whole of nation approach na talagang tulong-tulong tayo, and for that we are very thankful. Marami po tayong trabaho in front of us, no? Malayo pa tayo, na we are far from over with the vaccination program. Hindi pa tayo nagkalahati with our targets, no? But as of this moment, with the protektahan. With this po, maybe when we have covered all our priority group E2 and also have accomplished yung kailangan natin makover din ng priority group E3, then we can cascade na po dun sa mga less vulnerable at saka mga younger population if kaya na po ng supplies natin. At if the time comes, no, kailangan din natin yung full support yung lahat. No? And thank you very much for joining us today.
Thank you, Dr. KZ. At ngayon po para officially na ay makapagbigay uli ng message ang ating National Commission for Muslim Filipinos, may I call in po the spokesperson, Dr. June Alonto Datu Ramos. Dr. June? Mukhang nagkaroon ng technical glitches po si spokesperson June. So, with that po, hingi na lang po tayo ng short message from our DOH spokesperson, Yusek Rosette Vergeire.
Yes, thank you, Casey. Gusto lang ho namin magpasalamat sa inyong lahat sa pagdalo at pagpapaunlak nyo po dito po sa ating Infocaravan, Tutok A2. Lagi po natin tatandaan, napakahalaga po ng mga bakunang ito. Ito po ay pinaghirapang maigi ng ating gobyerno para maibigay na proteksyon sa ating mga kababayan. We have to be very cautious at this point dahil po yung mga variants of concern, yun pong Delta variant, yung Alpha variant at saka yung Beta variant ay detect na po natin sa iba't ibang lugar dito sa ating bansa. Ang Delta variant po is a highly transmissible variant. Mas transmissible po siya dun sa Alpha variant na tinatawag natin na unang na-detect sa UK. So ano po ba ang ibig sabihin nito? Kailangan po natin ng dobling pag-iingat sa mga panahong ito. Lagi po natin tatandaan na ito pong mga ginagawa nating safety protocols katulad ng pagsusuot ng mask, pagsusuot ng face shield, pag-physical distance, hindi pumupunta sa mga matataong lugar. Pag pumunta po tayo sa mga enclosed spaces, siguraduhin na well-ventilated po ang area na yan, palagi ang pag-uugas ng kamay at ang pagbabakuna. Lahat po yan ay proven na makakatulong at makakaprotekta sa atin para labanan po natin ito pong COVID-19 and its variants of concern. So sana po tulungan nyo kami na maipakalap po natin ang tamang impormasyon sa ating mga kababayan, mga kapitbahay, mga mahal sa buhay, na ang atin pong pagbabakuna ay napakahalaga, ito po ay ligtas, ito po ay makakapagbigay ng proteksyon, ito po ay na-certify ng Food and Drug Administration at ng WHO for that matter. So kaya po tayo ay sigurado na ito pong mga bakunang ito ay makakabigay sa atin ng adequate protection para po dito sa COVID-19. So sana po tulungan nyo kami na mahikayat natin ang ating mga lolo at mga lola. Naibigay ho kanina ng ating mga resource persons kung ano po yung vulnerability o yung bakit ang mga lolo't lola natin ay delikado kapag sila ay nagkaroon ng COVID-19. Naibigay din po ng mga resource persons natin kanina kung paano maproproteksyonan at kung ano ang mga bagay na dapat gawin para magkaroon ng proteksyon si lolo at si lola. At isa na nga po dyan, pinaka-importante, ay bakuna. Naintindihan ho namin, maraming mga lolo at lola, hindi po sila nakakagamit ng mga application para makapagpa-master list sila sa bakunahan. Hindi rin po nila naiintindihan minsan ayun pong scheduling na ginagawa ng ating mga local governments. So hinihikayat po natin ang ating mga local governments, let us have some strategies for our lolo and lola para mas marating po natin sila, maka-access sila, puntahan po natin sila sa bahay. Let us set up vaccination posts specifically for them para hindi na po sila nakikihalubilo din dun po sa bakunahan na maraming tao. And pangatlo, baka maaari magkaroon po tayo ng shuttle services para po sa ating mga lolo at lola at nang sa gayon, mag-increase po ang access nila sa ating mga bakuna. So with that, gusto ko lang hong again magpasalamat especially to our guest, Attorney Quijano, yun pong sa ating National Commission for Muslims, yun pong ating DILG, Yusek Dino and Yusek Iringan, of course, our ever supportive Dr. Nina Castillo Carandang, ang amin pong NITAG expert. Also from UST, Faculty of Medicine and Surgery, Dr. Hoven, maraming salamat po. And to our DOH team and Dr. Casey for hosting this event. At sa lahat po ng local government officials dito, magtulong-tulong po tayo lahat para tayo po ay, sabi nga ni Dr. Anina, magkaroon ng better normal at magkaroon ng happy Christmas at lahat po tayo ay maproteksyonan. Let us all get vaccinated when it is our schedules already, but let us try to prioritize our lolo, our lola, our nanay, our tatay, our tito and tita, at lahat po ng mga kasama natin sa ating lugar na matatanda at may mga comorbidities. Thank you very much.
Thank you so much for the reminders po, Yusek. I think okay na po ang audio ni Dr. June Datu Ramos.
Yes, Assalamualaikum and good afternoon to all the attendees and speakers to this very important event. No, as a spokesperson of the NCMF, it is our duty to remind all Muslim Filipino communities to do their part in curbing the spread of this disease. No, we need to work hand in hand with the national government to control this pandemic and to return back to our normal lives. Hindi ito magagawa mag-isa ng gobyerno. Kailangan natin magtulungan at magkaisa sa lahat ng programa laban sa COVID. And I encourage all Muslim Filipino communities, those who are in the priority groups, especially the senior citizens, to have their vaccination done as soon as possible. We have to protect ourselves if we want to save lives. Our elderly are vulnerable, kailangan nila ng proteksyon ng bakuna. So maraming salamat sa lahat at magandang hapon po.
Maraming salamat po. Ngayon naman po, upang opisyal na isara ang ating pagtitipon ngayong umaga, atin pong tinatawagan ang Chairperson ng National Commission on Senior Citizens, Attorney Franklin M. Quijano.
Thank you very much, Dr. Halili. Actually, may presentation ako. If you'll be patient enough, I'll present it once and for all. Pwede.
Okay po.
Assalamualaikum warahmatullahi wabarakatuh. Peace be unto all of you. Alam mo, yung kalilintad, yung peace, marating natin pagka tayong lahat ay nagsusuportahan. So, rely ako niyo. Please allow me to speak in many languages. But let me present it this way. Immunity is the name of the game. Di ka madutlan kung immune ka. Di ka kelutang o immune ka. And we are saying that when we are born, may immunity ang bata. At lalong magka-improve yung immunity mo with breastfeeding. But as you grow old, you will have a problem with immunity kasi maraming stress ang buhay. So as you grow old, nagkakasakit ka. Kaya kailangan natin si Dr. Halili, si Dr. Verhire, si Dr. Casey Rosario, and we need to have advisors like Dr. Nina dahil the whole society is affected. Of course, just as we need medicine, we need to improve our immunity. So, kinahanglan magpabakuna. Kailangan ka-injeksyonan ta o mga doktor ta. We need to have our vaccines. So, I'd like to confess, noong November po ay natamaan ako ng COVID dahil nung inassign ako as chairperson ng National Commission of Senior Citizen, pumunta akong Maynila, nag-ikot ako, natamaan ako. After 9 days sa observation sa hospital, akala ko libre na ako. But even if I was asymptomatic, mayroon pa rin. Kaya another 14 days na quarantine. So I realized that yan, may amount of immunity nga ako, pero bakit tayo magkumpiyansa? Kaya last month, nagpabakuna po ako. I I was in Cebu. So, binigyan ako ng bakuna. Ito yung bakuna story ko. And this is what I would like to hope to convince you. Pag magpakabakuna ka, tataas ang immunity mo. Kung tataas ang immunity mo, halos hindi ka mabuwal. Di ka kelutan. You will not be affected. Dili ka maapektahan kayo kung doon na kay bakuna. So, daghan ang mga senior citizen nga ganahan magpabakuna. Gani sa DOH records, 90%. A lot of senior citizens are willing to be vaccinated. But there are still 2% who are not willing. Mamati man sila sa chismis. Uban na mga false news sa Facebook ilang pamation. We want to tell them, don't listen to fake news. Don't listen to chismis. So ang 2% angay na tong kumbensihon o pinaagi sa pagkumbinsi nila ang katupong uban nga gaduha-duha makumbinsi pod. Dunay 94 years old senior citizen sa Cebu City nga kada adlaw manawag kanus Asya bakunahan, si Mr. Carlos Espinosa. And I'm very happy that the local government of Cebu as well as DOH responded immediately ug tungod niini nabakanahan ang 94 years old giadto sa ilang balay. Mapasalamaton ko sa DOH nga nakahimo nagdesisyon apil ang local government units ug ang DILG nga kung ang senior citizen di makalakaw hinaut unta nga adtuon sa balay. Gani kung dunay ubang mga senior citizen nga gaduha-duha pwedeng dad-an o dunay sakyanan nga moadto. So kung mahimo man gani apil ang mga katabang nga nag-amuma o nag-atiman sa senior citizen, please let them be vaccinated. Sa igikaingon na nako, daghan ang magpabakuna, but I hope that we will improve with DILG and the barangays helping. Doon ay mga barangays nga dako kay katabang, labi na kung doon na sila sakyanan, doon nila ang magpabakuna ngadto sa ila vaccination center. So ang oras nato kining bisan og udto na atong tan-awon nga importante kayo. Labi na with the Delta virus, kinahanglan nga magdali gyud ta nga mabakunahan ang mga senior citizen. Kung ang mga senior citizen mabakunahan, apil na ang katong dunay mga sakit gitawag og comorbidity, mas maprotektahan ang atong nasod. Paspasan nato ni siya, atong kumbensihon ang tanan, atong kumbensihon ang local government unit nga magbatbutang og priority lanes, nga dunay mga vaccination post, apil sa mga barangay nga mag house to house, ug mapasalamaton ta nga ang mga partners nato, mga NGO o mga hospitals ni tabang. Sa mga syudad nga nang tabang ang mga hospital, salamat. Sa mga LGU nga dunay mga hospital nga di mo tabang, ato pong kumbensihon ang mga hospital. Ang pagprotektar sa mga may edad, importante kayo sa itong ekonomiya. Ang dunay edad na ay madawat nga income o tungod niini mo kusog ang ekonomiya. Ang dunay edad na apay nabilin nga mga abilidad nga makapabalik sa atong ekonomiya. Ang atong paningkamot sa tibuok kalibutan, angayang pag-aabton. We have to reach the level of safety dili lamang sa Pilipinas kung dili hangtod sa tibuok kalibutan. Kay walay luwas kung dili tanan luwas. Dai kauyag o di langon kauyag. No one is safe until everyone is safe. Hinaot nga pinagi niini magka bayluay ta og una-una, and I would like to thank you if you would like to communicate with the others and with NCSC na ang atong address, PH .ncsc@gmail.com o pwede pa ta makontak sa Malacanang. Salamat kaayo and Dr. Verhire. Thank you very much. Thank you very much, Dr. Nina, Dr. Casey, Dr. Halili, Dr. Mark, and all the other governments in the whole of nation approach. God bless everyone.
Thank you po, Attorney Quijano. And dyan po nagtatapos ang ating town hall today. Tutok A2 Resbakuna Virtual Infocaravan para kina Lolo at Lola. Maraming salamat po sa lahat ng dumalo ngayong araw. At maraming salamat po ulit sa ating mga experts on behalf of the Department of Health's Communications Management Unit. Kami po ay nagbibigay ng taus-pusong pasasalamat sa inyong kooperasyon at sa pag-stay po sa amin hanggang ganitong oras ngayong umaga. Maraming salamat po.
Salamat po. Bye. Ingat po tayong lahat.
Thank you, Doc Nina. Bye po.